Good afternoon. Welcome everyone to the May 21st, 2025 meeting of the Halifax Board of Police Commissioners. We have some new faces that will do some introductions in a little bit, but on behalf of everyone, we want to welcome Chief Superintendent John Duff, who is joining us as the new leader in charge for the Halifax Regional Detachment. Shh. All right, do we have a quorum, Madam Chair?
Chair O'Malley, we do have quorum. Thank you.
Thank you, Madam Chair. And I understand that Commissioner Akindoju will be joining us a few minutes late. So we'll... Oh, did I? Oh, my apologies. Thank you. So we'll call to order in the land acknowledgement. So the Halifax Regional Municipality is located in Mi'kma'ki, the ancestral and traditional lands of the Mi'kmaq people. The municipality acknowledges the peace and friendship treaties signed in this territory and recognizes that we are all treaty people. Community announcements, item number 2. Madam Clerk, are there any community announcements?
That will be up to the commissioners if they have anything that they wish to share.
No, thank you. Item number 3, approval of the minutes from April 2nd. Can we call for the approval of the meeting minutes from April 2nd? Commissioner Kent and Commissioner Hinch, thank you. Is there any errors or omissions that were to be noted? No, barring none, call for the question. All those in favor of adopting the minutes? Motion carried. Thank you. Approval of the order of business. Are there any additions or deletions, Madam Clerk?
Chair O'Malley, there is one addition, item 11.1, Commissioner Kent, CAPG Annual Conference.
Thank you. I guess we need a motion to approve the addition or the agenda as a whole. Can we have a mover and a seconder to adopt the agenda as a whole?
I'll move that.
Commissioner Kent and Commissioner Hinch. All those in favor? Thank you kindly. Item passed. All right, moving along. Are there any, for declaration of conflicts of interest, are there any declarations of conflict of interest by any of the commissioners that they would like to share at this time? Barring none, we'll move on to the next agenda item, consideration of deferred business. A long overdue item, one that's we've been waiting for, which is the community safety update on public safety strategy and crisis response, which will be a presentation by Dr. Amy Siciliano, the public safety advisor, and I believe the acting executive director. Very good. Thank you.
Great.
Dr. Siciliano.
Hello. Okay, you can hear me. Thank you very much. My name is Amy Siciliano. It's a real privilege to be able to share with you the successes we've had over the past year of implementation in year 2 of the municipality's public safety strategy. My role is lead for research and development team, and as a part of that role, I oversee the development and implementation of the municipality's public safety strategy. But the strategy itself is shared across a number of key partners, both internally and externally, and I'll share a bit more about those partners with you as we move forward in the presentation. As requested by the Board of Police Commissioners, I'll spend a little bit more time. I'll spend less time overall in the strategy, and I'll spend a little bit more time focusing on a really exciting new service that we are launching this year, the Community Crisis Diversion Service. So that'll be the bulk of my presentation today. So in order to understand where we are today, I think it's really important to understand where we've come from. And so in front of you are the key milestones that have led to our current public safety strategy implementation. So this work started a long time ago, led by Dr. Don Claremont at the request of then Mayor Peter Kelly in 2006, when HRM was experiencing a spike in violence, particularly concentrated in the downtown core. Dr. Claremont brought together a number of community stakeholders and did a lot of consultation in community with community to understand how HRM could take a different approach, a more holistic approach and a more upstream approach to addressing violence in our community. That led to the report, the first one you see there in 2008, which had a series of recommendations in it. One of the most important ones, I believe, was the creation of a public safety advisor, and that person was meant to be located high up in the organization in order to provide a way for us to kind of steer the ship upstream, if you will. So really focus on what we can do proactively in a preventative way, addressing some of the ways that we can, some of the ways that we can prevent harms from happening in the first place. And so this led, so that led to the very first public safety strategy, which Regional Council approved in 2018. It was a broad strategy. It had a lot of actions in it. I would say it was aspirational, but it did a number of things and led to a few successes. I just want to highlight a couple of them. And of course, you can read about all of our work and the progress we've made each year since 2018 on the Public Safety Strategy website, where we report annually to Council. So the report I'm giving you today was presented in a different form, but same message to Regional Council a couple of months ago. So two of the key successes that I want to highlight is from the last public safety strategy is first, it really broadened the way we see and understand in a very tangible way public safety. So from, I would say, a more police-centric approach to a more holistic, upstream, ecosystem-based approach where, you know, we could all see ourselves in creating safer communities. The second success is that previous public safety strategy actually forged new pathways and built and renewed relationships with some of the key players in our community that we need to work with to create safer communities. And we developed two programs out of the strategy that have helped advance this work tremendously. One of them, the community mobilization teams, which is a program led by my colleague Lillian Ash's Program and Partnership Division in Community Safety, that works with African Nova Scotian communities primarily, but we're moving into Spryfield as well, to work alongside community to prepare, prevent, and respond to community-led violence. The second program is led also by Lillian Ash's team, and it's called Safe City and Safe Public Spaces, and that's a program that's meant to address gender-based violence in public space, and increasingly looking at how we can play a bigger role, particularly in the wake of the recommendations from the Mass Casualty Commission in addressing intimate partner violence. And you could read more about that work in the annual report that was circulated to you all. I think when at some point it was circulated to you all a few weeks ago. And so the current strategy, which you see there as well, was unanimously approved by Regional Council in March of 2023. And it's informed by the success of these milestones, as well as new research, internal and external engagement, existing regional council, and Board of Police Commissioner reports. So, you know, and I would say in a nutshell that what we're trying to do in this new strategy is really strengthen that ecosystem that we started to work alongside back in 2018. And so why? Because we know the evidence tells us that upstream approaches are the most effective, least costly, and least harmful way to create safer communities. When we strengthen our ecosystem, we reduce the risks of criminalizing social and health issues that we increasingly are seeing in our community. We know from research and from the work that we do every day that police are just one component of creating safer communities, and we need to strengthen the ecosystem to ensure we have a broad way of creating community safety. And, I said in the name of this new business unit that the new public safety strategy was a big part of creating. Communities need to be at the center of creating the conditions for safety and well-being. And the team in our business unit, along with our partners, both internally and externally, really play an amazing role in centering community in the work we do. So there are 3 action areas in the public safety strategy: community-led public safety leadership, and much of that work is a continuation of the work that we started with the previous public safety strategy, with the addition of a new community safety training program. And I know some of the council has received training through our new training program, and perhaps some of the board as well. Broader spectrum of response, and that's what I'm going to spend the most time talking about today. And then a center of responsibility for community safety. And really that's about relationship building and ensuring that we have our pulse on what's happening in the community, and that is always informing the work that we do. So there's 14 actions within each of these strategic action areas. And again, I'm not going to go over each one of them, but I'm going to focus more broadly on the middle one. But before I do that, a big part of our work is measuring and monitoring the impact of the work that we do. Prevention work can be tough because it's hard to demonstrate, the success of something that didn't happen. You know what I'm speaking of. And so we do this in a number of ways to help tell the story of the impact that we do. So the first, I would say, is that each action area has an outcome or a set of outcomes. And what that means is the change that we aim to make over time. We track activities within each of the action areas that are contributing to this change we aim to make. These activities are informed by a theory of change or a set of evidence-based assumptions about the relationship between the activities and the outcomes. In some cases, we are doing external evaluation and a little bit of internal evaluation of the actual programs that we're doing. So for instance, the community safety training program, we've partnered with the Claremont Center for Community Safety at Dalhousie University, and they're doing an external evaluation of the impact of trauma-informed nonviolent crisis intervention training on municipal staff and volunteers. We do that to help articulate the results as they relate to these specific programs or initiatives. We are also tracking population level measures. So indicators, if you will, of what the state of safety is in a community. This is where something like crime statistics actually are valuable measures, but also levels of social cohesion, material security, and other social determinants of health. And I'm happy to say that Halifax was selected to be part of one of 10 cities across Canada to participate in a public safety funded project that's developing a set of standard indicators that municipalities across the country will be using to measure and monitor the impact of community safety. So we're about year 1 into that pilot. Okay, so into the work now. So as I mentioned, I'm going to focus on the second action area, which is the broader spectrum of response to social issues and harm. And really what we're trying to do in this action area is broaden the continuum of services that we provide so that we don't have to rely as heavily on police, particularly when it's not appropriate to do so. And so there's a number of actions in this action area. The first, I know I've spoken to you about this before, is a stabilization center. And this is work that's been underway for a while. It's not yet implemented because we are still searching for a location. But the idea is that we'll have 10 beds that will be available to some residents who are under the influence of substances, and have no criminal charges. And instead of them sobering up in the prisoner care facility, we'll provide a safer and more appropriate alternative for them. The Mobile Outreach and Transportation Service was launched this year led by Housing and Homelessness, and this is an after-hours response and support for primarily people who are experiencing homelessness and living in encampments. there's a number of actions that or activities that we're doing under an action in the strategy that's meant to support youth. And so a lot of this is funded through a grant that we've received through Public Safety Canada. So we're doing some outreach with young people, partnering with Posse. So that's peer outreach support services and education. That work is happening primarily at Alderney Landing and Bridge Terminal, and I can talk about it in more detail if you're interested. Mobile youth support team that's run through Parks and Rec. There's a counselor and there's a youth outreach worker that are working primarily in our recreation centers. A youth response table that's meant to identify the best service provider for youth who are at high risk. So there's a service provider table that's being formed, and they would discuss specific cases related to youth who are at risk of harm from the criminal justice system and redirect them to an appropriate service provider. And work that's being done with the African Nova Scotian Justice Institute on a justice navigator, which is helping young people who are involved with the criminal justice system navigate that system in the best way possible. There's work that's wrapping up with the Nova Scotia Criminal Justice Association on a drug policy working group. And I'm happy to speak to that in more detail if you wish, but I want to turn now to, I would say probably one of the biggest actions in the whole strategy, which is the development of the Community Crisis Diversion Service. Okay. Sorry, I just need a drink. So, what is it? Well, the mandate is to provide immediate 24/7 in-person support and intervention to individuals in distress with the goal of stabilizing the situation and connecting those folks with appropriate resources. And so this is, what does the service look like? So there will be a dedicated phone line to access the service, and I am just delighted to report that we've signed an agreement with 211, and we have our colleagues here, Kim and Paula from 211, who've been just tremendous to work with as we move toward implementing this service. So you're gonna be able to call 211. They have, and if you don't know about their community navigators, I can't say enough about them and how well they're trained, but they are going to help identify whether a call that comes in would be appropriate for this new service. And then if so, they would then dispatch the service. And so that's the intake piece. And then there'll be a mobile community team that will actually be on the ground responding to the calls. And what that team will do will depend on the situation, but some of the things that we know that they'll do from services that are in operation elsewhere and from what we've heard from the community that we've consulted with and in the development of this service is things like crisis de-escalation, safety planning, which could include transportation to a safe place, basic needs, client advocacy, and connecting or referrals to services to meet persons' immediate needs. It's important to note that the intake and evaluation criteria that we're developing with 211 will do all that we can to ensure that the service is not responding to situations where threats of violence or use of weapons are present or likely to occur. And I'll talk a little bit how we're working with the police and IES on bringing those calls back to 911, an emergency response if we need it. So I'll talk about that in a second, but I just want to talk a little bit more about the service. So it's consent-based. It's a non-medical model. And the team will be trained. So they're not clinicians. But they will have a series of trainings that will enable them to respond to calls related to mental health, well-being, substance use, and other safety concerns from a trauma-informed and culturally relevant care perspective. As I mentioned, there'll be an intake line to receive and evaluate calls, and where appropriate, dispatch the team. And that team will support individuals where an emergency responder may not be appropriate or beneficial to that situation. And so, a variety of situations that you may be familiar with may fall into this category, and some examples include threats of suicide, erratic behavior, well-being checks, and disputes. So those are some of the call types that we've looked at from working with police to understand where we might be able to intervene with this service. As I mentioned, the team that is responding, and as well as the team that is receiving the calls, will be highly trained. The community navigators are already highly trained, but we'll be supplementing with that some additional trainings. And this is a list of some of the trainings that will be required. Another piece about this service that I wanted to share with you is, well, let me back up a bit. So in last year, Regional Council directed us to contribute to broadening the spectrum of responses to intimate partner violence in the municipality. And a portion of the funding that Council directed to that is being incorporated into this service. And so first what we did was we did some consultations to understand if and how this particular community crisis response service could respond to some forms of intimate partner violence. So we conducted a jurisdictional scan first with Dr. Diane Crocker on municipal and community responses to intimate partner violence across North America. We engaged in dialogue with other jurisdictions who are running community crisis response services. We engage with local service providers and people with lived experience of IPV to understand if and how this service could respond to some instances of the situation. And as a result of that work, we are incorporating, maybe incorporating is not the word, we're building into this response, the crisis diversion service, a way for it to be responsive to some forms of calls to intimate partner violence that would also meet the other criteria. So how we're doing this is we're developing policies, practices, and procedures that would equip staff, both at the intake, but also at the response level, to recognize IPV and gender-based violence and understand how they can support service users with gender-responsive, culturally responsive, and trauma-informed approaches. We're ensuring connection and integration with local service providers who offer those specialized supports. And we're doing this because the research and engagements has suggested that we can do this, and we can provide supports in this way with safeguards in place, of course, to understand how we can do it once we operationalize the service, what exactly it's going to look like, in other words. Okay. Oh, I just wanted to say, and so some of this too, so to give you some examples, so supporting callers with safety planning, meeting callers in a safe place to discuss resources and how to connect with service providers, offering transportation to a shelter or a safe place. And the other point that I wanted to make is you may be aware, but THANS is working with 211 right now. You may have seen the posters on our buses across the city, promoting women who are experiencing intimate partner violence or domestic violence to call 211. So, you know, that was happening independent of what we were doing and before we knew we were working with 211. So we really believe that this work, this can merge together to provide a better response. Okay. So of interest to you, I'm sure, is how this particular service would be integrated with police. And there's kind of 4 ways that we see IES and police integration with this community crisis diversion team. So there could be an officer on patrol who realizes they don't need to be there, that the police response isn't required. They'll be able to call back. There'll be a backdoor number to 211 to be able to get that team, the crisis team, dispatched to help. Calls that may come in directly to IES would be, if it meets the intake criteria, would be diverted to 211. We are not there yet, but in the future, we'll be looking at how to do referrals from IPV-related police services, and we've had many discussions, and we'll continue to have discussions with victim services to understand exactly what that could look like in the future. And then, of course, as I mentioned before, you know, their calls may come in for the community crisis service, which would require an emergency response, and this is not an emergency service. And so if it requires an emergency response, 211 would, and they already do this, divert calls to IES. This is important to have this type of integration because we want to have a no wrong door approach. So while the service can be accessed and will be promoted as being accessed through 211, there will be other ways to access this service. We just had a great meeting as well with the Mobile Mental Health Crisis Team, the provincial crisis line as well, to talk about how we're going to integrate with the work that they're already doing in community responding to mental health calls. Okay. The design of the model was based in part on learnings from other jurisdictions, including how to kind of evaluate the effectiveness and also just monitor the results. I'm happy to share these PDFs. I have a few copies in my binder if you want. And so I just wanted to give you a snapshot of some of the ways that we're going to be collecting information and sharing it back to you and others on how the service is working. So call diversion will be important. So understanding, in Toronto, they're looking at how many calls are being transferred from 911 to the new service. In Ottawa, they're looking at how calls are handled by the anchor team is the crisis team, so with no police involvement at all. And so those are two metrics that we'll also be looking at. And then, I'm not going to go through all these, and I think I have another slide as well that shows, but you will be able to track, and we're working with the Claremont Centre for Community Safety on an external evaluation of this program. So we'll be able to collect this type of data and share it back with you. So you can see the service is, so Ottawa is 6 months. That's the data you're seeing from 6 months after implementation. The Toronto data is from 1 year. And so you can kind of see how the service is working, how it's being accessed. And, there's other information that I don't have here on the slides, but what kinds of supports they're providing to the folks that they're interacting with as well. So I'm happy to talk about what we've learned there. But I'm going to wrap up. So that's the big one that's coming this year. As I mentioned, we have an agreement signed with 211. We're in discussion with the service provider for the actual mobile portion. So that will also be a community-led. We'll provide the backbone support, but it's going to be a community service provider that's running it. We're doing other things though. We had just had a really great 2-day workshop on preventing hate and violent extremism in a partnership with Public Safety Canada and the Canadian Practitioners Network for the Prevention of Violent Extremism. They're subject matter experts, not only in Canada, but internationally. We are going to be host city for the Canadian Centre for Safer Communities National Conference, November 4th to 6th. I encourage you to get a ticket and join us, or if you feel like presenting, there's a call out now for speakers. It'd be great to hear from folks in Halifax. I know there's really good work happening. We're launching new trainings and scaling up some of the pilots for the trainings that we've done, and you can see the list there. Kicking off research and engagement for a public safety strategy renewal. And wow, yeah, that's a lot. So I will leave it there and happy to take any questions. Thank you so much for allowing us to share our work.
Thank you greatly. I'll open the floor to our commissioners, who I'm sure will have lots of questions. Commissioner Mancini.
Thank you, Mr. Chair. Dr. Siciliano, thank you for you and your team for your work and your passion on this topic. Man, there's a lot to uncover here. So, Mr. Chair, track my 5 minutes because I'll be tapping out a number of times here. First of all, 211, glad that that's happening. You guys do amazing work, and most of our residents still don't understand 211, putting aside this topic. And we need to get that message out for sure. So that's great. And historically, we've been in these chambers when we were talking about police budget, and then people have been lined up, and they use the term defund, which I never agreed with, and I'll agree to the task detask. This is a perfect example of detasking because our officers don't want to be doing some of the stuff either, but most of the time they're the only ones at 11 o'clock or 1 o'clock in the morning or 4 o'clock in the morning. So fantastic. We're moving down this path. Can you talk about, and maybe this is a question for the chief, but you're talking about the example, the officer on patrol comes across a situation. What kind of training does that officer have to make that decision that that's not a policing situation where in the past it would have been? So, they would get a call, someone's disruptive, out of control, getting in there. Is that a policing? So is there specialized training that officers are going to go through so they can make the right decision?
Through you, Chair, to the Commissioner, thanks for the question and thank you for your kind words. So thankfully, we have a member of HRP, John Smith, on our working group for the development of this model. And what we've heard in terms of, and I certainly defer to the chiefs on this, is that aside from raising awareness and presentations on what this service is and how it will be operationalized and what the kind of criteria are for accessing this service, we will be going to the watches to present this new service and provide training to the officers that way. That, from my understanding, that's the best way to raise awareness about this. And, it's also going to be practice.
Yeah, because the fear is it easy to say, not us? Or is it fair, this is us, it shouldn't be us, right? And so that's the fear or the perception out there, right? So just want to make sure maybe the chief later on can chat about that too. So is there a launch date?
Well,
When the switch
I
gets turned on?
can't commit to a launch date because, we have service agreements signed or about to be signed, but it will be also how quickly they can hire and onboard the folks that need to be in place before we can actually.
Weeks, months?
I'd say a couple of months.
Okay. I'll come back, Mr. Chair. I'll leave it to my colleagues and I'll come back. Thank you.
Commissioner Bezic-Escalera.
Thanks, Mr. Chair. Thanks, Dr. Siciliano. As you can tell, this is an area that is near and dear to my heart as a preventive medicine physician. I'll make it quick. Three questions, if I can get through them. One, you talked about the data plan. As you pointed out, changes or shifting the response from police or other emergency services to this service is one measure. I'm wondering how, and maybe we can talk offline about this, how you're going to look at things broader outcomes, touching on those social determinants or talking about the bigger picture of safety. One thing that comes to mind is tracking repeated calls, so things pertaining to the same person. If we can see that the 211 service leads to that person not requiring 211 service in the future, that may be something to be looked at. And kind of related to that is integration of information systems. I wonder if there's going to be situations where police may have responded to an individual. Will that information be available to this crisis team that makes a response, or EHS or something like that? I'll pop there. Stop there for an answer, if you can.
Through you, Chair, to the Commissioner. So the first question is related to, could you repeat the question?
So
broader social determinants of health.
Yeah, so thoughts of outcomes that you would measure other than, the Toronto example and the example from Ottawa, the alternate neighborhood crisis response, or ANCHOR, are great. But I'm wondering if there was anything else in your data collection plan. And like I said, maybe we can talk offline about things that we may consider.
Yeah, I would love to get some input from you into this. I think for our purposes, given our mandate, we are focused on being able to provide an alternative response to police, recognizing that this alternative pathway can create better long-term outcomes for folks accessing the service. And so we haven't determined exactly what those measures will be or our capacity to be able to collect that, given that we want to focus on making sure we stay within our lane. But we do know that by giving folks clearer pathways and more immediate pathways to access the services that they need, that the evidence shows that that's going to improve outcomes. 211, and they could perhaps speak to this, collects a lot of data on met and unmet needs. And so we can also use some of that data to understand how this particular service can help folks that may have unmet needs meet those needs. They're nodding, so that's great. And then the second question was related to sharing of information.
Sharing information with police. I'm picturing situations where EHS or police has responded to an individual who may or may not have received 211 services or may benefit from them, or vice versa. You all get a call and it may be something that you have information that may shape a future police response or a future EHS response. Is there anything along those lines?
That's a tricky question.
Yeah.
So, you know, best practice from what we know from others who have implemented this service is that we want to collect as little information as possible.
Okay.
And one thing that stuck with me in particular in a recent trip that we did to Ottawa was one of the women who works for 211 really emphasized to us that you need to treat each call as if it's the first time calling, because when you start to bring in the history of that call, you're pathologizing the situation, and they may be calling about something completely different. And we wouldn't also want to create a barrier for accessing this service based on a past history. So we do need to. There's also important considerations that we need to understand as well related to specific incidents. So we're not we don't have all the answers, but we do know that it will be important to keep the information minimal and to treat the call as if they're accessing this service for the first time.
That's great. That helps me understand. I'll pause and allow other questions.
Commissioner Hinch.
Thank you. Thank you so much for this presentation. I greatly appreciate it. Long overdue. I did recently meet with CMT folks, and I was quite surprised about what they do. The thing is that I hope and that you guys do more outreach to the communities, or talk to the communities about these programs that are being led by you folks, because again, as we in the past, or when I first started out here, and then we had the folks that were defund the police and all that stuff, like Commissioner Mancini has said, and they're looking for other avenues, they're looking for other sources other than the police to help navigate their certain situations in the communities. So my hope is that you guys do a lot of engagement. That's where I want to go out with that. Do engagement in the community, because again, when it comes to next year, when we have the budget, I'm hoping that we can minimize these folks from coming forth and saying defund the police and all that stuff. So yeah, that would be my question. More engagement. Do you plan on?
Through your chair to the commissioner, thank you very much. Agreed. We need to be louder and bolder in how we promote our work. And I think with the support of the still new Community Safety Business Unit, we are working toward that. I'm really glad that you met with Raven and her team.
Yes.
Because we will rely on you as well to support that promotion in all the outreach that you do in community. And Raven has lots of cool swag and rack cards that she can fill you with when you're out and about, because that's a really great way. That personal connection is a great way to promote this, because it is the community mobilization teams, as I'm sure that you saw, is really it's built on relationships.
It is. And we do plan on having another meeting and doing a walkabout and everything of that nature. So yeah, I'm excited. Thank you.
Commissioner Kent.
Thank you, Mr. Chair. So, Amy, you know that I'm thrilled to hear you come in, and I really appreciated seeing the historical shifts as it went forward. It's a shame it took that long, but councils change, different players at different points. Really happy to hear that we're getting closer to the diversion. service. On your challenges of that, well, first of all, thank you as well for all the work that you're doing. It's wonderful. The Crisis Diversion Center, I 2 questions on that. I'll start there. One is your challenge on location. Is that what that,
The
am I right?
stabilization center is the
Oh, that
location.
one's, oh, okay. Thank you. I had that wrong. Then I'll go to my next piece. The crisis diversion, is that going to be a full launch in HRM, or is that a pilot that you'll have an area that you'll, how would that work?
Through you, Chair, to the Commissioner, thank you for the question. That's a great one, and I didn't mention it. It will be in a limited geographic area to start, and we also won't be able to start 24/7. So we have a
Okay.
plan with 211 to start 24/7 by January. But because they currently contract out their service after 8 p.m. right now to Toronto, and Toronto couldn't take this additional service on, so we need to build up their capacity to be able to do business locally 24/7. And yeah, and so the time and the geography will be limited, and we don't have the budget to do a HRM wide, and nor do we know that this is what HRM wide needs. So that's why we're starting small, studying it heavily, coming back to council with our recommendations on if and how we should build out.
Okay, do I still have time for one more quick question? On this same service, when you talk about diverting a call to wherever it needs to go in this service, in that spectrum, in particular, you said diverted to 211. Is for the caller, is that seamless? Or is it, I hope it's not them telling you should call 211 if they've called 911. How is that going to work?
Okay. There is a backdoor number that IES. We're building this right now.
Okay.
There's a backdoor number through IES that they'll be able to call, so they're not going to have to wait in the queue,
Right.
and they'll be able to the person at IES will be able to share information about this call with the community navigators. Now, another thing I learned in Ottawa, it's important to actually ask that person once they're connected with the 211 navigators what their story is, because they may not have disclosed all the details, or they may have a different story than they would have told our 911 operators. So they would be asked to tell the community navigators what's going on, and then at that point, that call would be evaluated as well for the appropriateness for a dispatch.
So just so I get it straight, someone calls in
To 911?
to 911 and they would explain quickly what the situation is, I assume. 911 when they divert, I understand the background, what I'm thinking about is the one person calling.
Yeah.
How cumbersome is it for them? They going to get a phone number to call?
No.
No.
They'll be transferred through.
They'll
a
be transferred through,
backdoor-
good. So it's more seamless for them.
Yes. Okay, sorry.
That's what I was trying to
misunderstood.
get
Yes,
to.
no, they'll be transferred through a back door.
Yeah, okay. Excuse me. I'll finish there and come back.
Thank you. I'll allow for time to Commissioner Moore to make an additional information input.
Thank you, Chair. Just in that piece, I just want to be clear that it's not 911, it would be integrated emergency services. So 911 is provincial in nature. There's four public safety answering positions across the province where basically we'd redirect a call to either police, fire, or ambulance. And then once it reaches a dispatch center, so it would be, in our case, it would be transferred to a call taker in integrated emergency services in HRM, who would then have the conversation and then go from there. So I just want to make clear that we are not connecting our service directly to the provincial 911 system at this point. Now, that may be a future version, but I just want to make that nuance, because some people refer to 911 as the provincial system and others refer to it as our local dispatching center. So good. Thank you, Chair.
Commissioner Akindoju.
Thank you very much. I was going to start by asking the question, how do you define crisis diversion? I was going to start from exactly what she said, because most calls that I will recall will go to 911. And at that point, are you saying that 911 will decide that, no, this is not our call? I'm just trying to make it very simple for my understanding. It should be 211 call. You all know that crisis can be defined in different ways, and there are different calls. You don't know until you get there. You can ask the police that they do not draw their guns until it is actually necessary. They do not go to emergency calls just to draw guns. It's the situation that they see that actually leads to whatever they do. And my own caution is, first of all, like I said, how do you define crisis diversion? I want to be clear about that. That's number one. Number two, I like the word outreach function. So I'd rather think the community crisis management group, not diversion, would rather be proactive. That is, reaching out, talking to people, understanding behaviors, using 211 history to identify critical areas where they can go and improve community. That's rather than receiving calls and attacking those calls. It could be very dangerous. That's my. And the other thing is, how did you arrive at geographic location you mentioned? Where, which areas are you looking at, and how did you arrive at that? I guess you mentioned earlier. Did you say Black communities? I'm not sure. And you said next will be Spryfield. That's the question.
Okay. Thank you.
Thank you.
Through you, Chair, to the Commissioner. So I think your first question was, how do we define crisis? So we don't define crisis, but there's a variety of situations where by looking at calls for service that are currently coming in to police, by looking at calls that are coming in for support, mental health, for instance, support to 211, and by looking at other jurisdictions, we've developed an intake criteria. So there would be, it's not a call type that we're diverting, but it's a series of questions that we would ask to see if this service would be an appropriate service. I'm happy to share offline with you what that intake and evaluation criteria looks like, but it's quite an extensive process of questions that we would go to understand the situation. We know from the research that we've done that there are calls that police are responding to that they wouldn't need to be there because it doesn't require a police response. And we know from other jurisdictions that have the service that's very similar to the one that we're standing up, as you saw from the data that I shared, that there are calls that can be diverted away. In terms of the prevention piece, I agree. I'm a prevention person, but I also am an and not rather person. So I think we can do both. I think we can focus on prevention while providing an alternative response. And I think we can do that because I believe that by providing an alternative, we're actually working toward prevention, because sometimes a police response can be harmful and traumatic, even though there's no intent for it to be that. And so we can prevent that harm from happening. And that's the space that I think we're working in and working toward. The areas, I think you're referring to the community mobilization teams. So those community mobilization teams operate in the Preston townships, in central north Halifax and in Mulgrave Park, and are moving into Spryfield.
So my question was, how did you determine
Oh,
that?
the area.
Why didn't you start downtown?
So the question around the pilot geography area for the
Correct.
crisis.
Was
Yeah.
it based on the amount of crisis year over year?
Yep. Sorry, I forgot to answer that question. So the pilot area, and it's not nailed down yet because we want to have that discussion with the service provider that will be doing the mobile outreach. It has been informed by an analysis of data from RCMP and HRP, an analysis of data from 211, and an environmental scan of the services available in HRM. We also want this service to be accessible to both HRP and RCMP, so that's also informing our pilot area, so that we can divert from both police services.
Commissioner Mancini.
Thank you, Mr. Chair. So, Amy, we've heard many stories of the wellness checks going sideways. So can you walk us through, you continue to talk about the intake, and so, there are times where maybe that wellness check is identified, doesn't need a police presence. Sometimes it is, and is the training going to be for police to go together at times and then step away once it's confirmed that they're not needed? Could you just talk a little bit about that wellness piece, the wellness check piece?
Through you, Chair, to the Commissioner, yes. So to start with the last question, if it and based on our understanding from other places, there could be situations where both police and the crisis team are dispatched. In that instance, likely the situation would be that police would determine whether or not they needed to be there, and then if they didn't, then they would hand it over to the.
That's the police decision, right? So we're not going to have a scenario where there's a disagreement of who should go in first. We're going to avoid that scenario, right?
No. Yeah. I think that's an important piece.
Yeah.
That if both are called, it would be up to the police to determine that that the crisis team is a more appropriate service for that particular situation. In terms of wellness checks, I mean, I think there's a wide range, and there's experts in the room beyond my expertise that could explain all the different ways that a wellness check might play out. But we do know from our conversations with police and research elsewhere that there are types of wellness checks that would be appropriate for this crisis service. And again, it's not. It's the way that the call will come in and be assessed for whether or not it's appropriate. So is the person, over 16? A series of questions will be asked to understand exactly whether or not this service would be appropriate for this particular call, not whether it's a wellness check or not, but whether the service itself meets what that person needs or requires.
Thank you for that. And I'm very pleased to hear that the intimate partner violence and gender-based violence is part of this service. As we know, we're in a crisis in our community, in our country, when it comes to that topic. And part of the challenge with intimate partner violence is it's so underreported. So I'm building on the commissioner across the ways, a comment about data sharing. So does this data, if that call from the team goes in and it is related to intimate partner violence, does that data get shared with police? Because we need to make sure we have the data when it comes to this topic as we proceed.
No, there would be no sharing of data with the police.
I guess I mean the call, that the fact that the team made a call and it was an intimate partner violence call. Doesn't have to be the details, but that, in my opinion, should be part of the data that they report on when we ask the question, how many calls of intimate partner violence? So that data, in my opinion, should be collected and shared, not the details, but.
So I would suggest that one way to bring that information forward to the board would be to ask for a report on on our service, which would be public. So we can, when we report on the types of situations that the crisis team is responding to, the types of needs that are being met, there could be a category there related to how we are responding to intimate partner violence. Certainly that's a part of our data collection plan and how we intend to evaluate the service. given the direction from council to, for us to provide an alternative. So it would be, I wouldn't say that it would go into police data, but it could come to the board on its own so that you could have an understanding of the role that this service is playing in responding to intimate partner
So
violence.
we, as a commissioner, should be asking that question on a regular basis, what are the numbers? So now we just, so we know, we now have to ask two different places to get the true numbers. That's all I'm saying. And that's fine, you want to keep it separated, but I think it's more for our conversation. There are others, I'll come back one more time after this if I may, very quickly.
Commissioner Bezic-Escalard.
Thanks, Chair. Thanks for taking all these questions. First question came to mind. I think it was Commissioner Mancini or Commissioner Andogu who brought it up about the wellness checks and the other teams. So just from my understanding, does this change anything with the mental health mobile crisis teams that already exist that pair up police and mental health workers? Any change to that, or is this?
Through you, Chair, to the Commissioner, no, it doesn't change, but we are collaborating with them. So we had a great meeting with them last week to talk about how they can also potentially divert some of the calls that they are receiving where a co-response is not needed. You know, this service will not be, the service that we're standing up will not be dispatched in calls that might be related to Involuntary Persons Treatment Act or any types of mental health forming that would be done. This is not the service for that. We have, thankfully, a service, the Mobile Mental Health Crisis Team that does that work.
And last question for me. So I know that your business unit doesn't fall under what we normally cover, I guess, as the Board of Police Commissioners, but is there anything that we can do as a board to help this work? Like, is it a policy from us that goes to the police that is in support of this, or public safety in general? Or, again, I'm the new guy, so I'm not really sure what else I'd like to do here.
I could ask a question too, so it's good.
Through Chair to the Commissioner, thank you very much. I appreciate that offer. Right now, we're working on an MOU with police for being able to divert the calls away from police to the new service. In terms of actual police policy, I don't think that we are going to require a police policy. We have had so far great collaboration with our policing partners, and we imagine that will only continue. But I'll keep that in my back pocket.
Commissioner Moore, did you like to add something to that?
Yeah, maybe I'll just jump in. So, Commissioners, prior to me taking on this role, I was sitting at that table down next to the chief and the chief superintendent. So the new executive director of community safety will be here on a regular basis to have these conversations back and forth. So it's not a one or the other. So that should become an ongoing discussion. And part of the role that I've been given is to help with that lateral alignment of cross services. So I'm the person, if you need, I'm here to help. So that we want to, and if we go right back to the policing transformation report, it called for a change in the governance model to allow for that kind of dotted line piece of outside of the board, but there needs to be a discussion on how all these pieces fit together, because we don't want to create another silo in and of itself. We want to create an ecosystem, as Dr. Solano said, that provides the best level of service at the right time to the right person. That's really where we want to get to. So any combination thereof, if that's the right recipe, then that's what we'll deliver.
Commissioner Akindoju.
Thank you for the opportunity. This is a great idea. But my background is finance. I've been in banking for 39 years before going to doing what I'm doing right now. And what we try to do is take money from innocent people and lend it out to people who want to use them. And you want that money back. So we really, really take time. I look at risk very, very important. And we look for mitigants. The world today, even in private sector, is moving towards unification. What I'm hearing in terms of security around here is diversification. I would have loved, I don't know, you said something, that the first call, we call him first respondent, don't we say that? The first call should always be one call. And the best people that could decipher what is this all about would be the 911. And I'll tell you a couple. There's 911, there's 211, there's 899. I have called one. I don't want to talk stories today, but if we could unify security, that is, there's a calling center 911, which everybody would remember. Crisis could be just being in the kitchen cutting turkey and cutting your finger, and there's blood. Crisis also needs to be timely response. A timely response. That's why it's crisis. Therefore, thinking or looking for either, we have so many calls now, you would agree. The central call 911 would decipher, oh, this needs policing. This does not. It goes down that way and quickly to the next. They know where it should be. But if the call goes from 211 or whatever call it will be later, then somebody is wasting time and something is happening at the event where that crisis is occurring. That's the caution I want to bring in here in terms of trying to mitigate this risk. Because all we're talking about is to mitigate the risk of an occurrence of an event that we do not want. So centralizing those calls, I think, would be a way to think about it, because you say you're still thinking about a couple of few things and signing MOUs with the police. I think that's one of the few things that I would suggest that we think about. Thank you.
Thank you. I think we're going to wrap there in terms of the number of questions, unless somebody wants to suspend. Okay. We've gone around twice. Would you like to finish it up? Oh, okay. My apologies. Commissioner Kent?
Thank
ahead.
you, Mr. Chair. So great questions from my colleagues. They're really important ones, I think, as as my colleague to the left here mentioned. I was going to ask the same kind of question, which is what can we do here at the board? But I want to drill in a little further on the ecosystems. I like that terminology because it truly is what our world is. There are ecosystems of space that there are so many players that contribute to potentially helping our residents in crisis or in health or in community safety. So I have a question around specifically around the ecosystem piece. Is there a role that we can do here at the Board of Police Commission to help strengthen that? I also want to know, and you've mentioned it, that you're working on an MOU, I think, around strengthening the ecosystem with the police. Part of what I would like to hear, if I can, is from our two chiefs on this, around what they consider this, how important this is to their service, how important this is to our communities who you're serving. And if you could help me understand a little bit, each of you, about what you see that the most important pieces that you can do to help strengthen these ecosystems and help strengthen the delivering this service.
Through the chair to you, Commissioner. Again, like I'll reiterate in terms as I spoke when we read the budget process, in terms of, this was something that we support. It's something I probably sat here for as long as I've been here, in terms of alternative response to policing, in terms of dealing with certain type of calls, is something we've always supported and will continue to support. We had a meeting not too long ago with Dr. Siciliano, and Commissioner Moore was there, and as we start to, there will probably be some hiccups along the way, as there are with anything that's new. That's just the reality of things that are new. But certainly in terms of supporting, the initiative is something I think that's all in our best interest. I think my people recognize that it's all in their best interest. We will work through the things in terms of, who gets there first, or, all those things will get worked through in terms of, I see no big issues with that going forward. I can tell you in terms of, you know, we look at our mobile mental health process that we have. When that was new, that was a, you know, that was the same thing. We were trying to figure out how's that going to work, right? It works seamlessly now, right? We've gotten through all that. I mean, I think, you know, I think the big piece will be around, you know, I think the important piece is that they have a 24/7 capacity to receive complaints and calls, 24/7 capacity to respond. Those are usually the things that get us involved in things, because there are a lot of people that do a lot of things. They just don't do them all day. You know, like, and the reality is, you know, this process is dealing with that. That was probably one of the first things I said when I was asked about this. If you're going to do it, you got to do it, you know, all the time. And I think, you know, we recognize that. So in terms of, like I say, we will figure out all the issues around, you know, 911, IES, the calls, the 201 and all those. And some of this will happen fluidly, I think, in terms of, because we do know there are lots of things that we go to that we don't need to go to. But at the same time, we also know there are a lot of things, I think, and it's recognized in Dr. Siciliano's, that there are things that we are going to continue to have to go through. And we need to be very upfront about that in terms of, and not give the expectation that all of a sudden that we're not going to go to anything anymore, because that's just not the reality in terms of some of the things that occur. And there will be a sweet spot somewhere in the middle where we'll have to figure out, like, really, where is that? And some of that will come with time. But I think at the end of the day, I think, you know, certainly community safety is committed to it. We're certainly committed to it. The RCMP, I believe, are committed to it in terms of, you know, so I think it's in all of our best interest to make this work. And I don't see there's no reason why we can't.
Chair, Commissioner. Oh, I needed a brighter green button. I can just speak, and this is something that's beginning now, so I think I'm, based on my background, positionally well to speak about it with not having any history here, not really required. I'm a firm believer in community safety being built upon a foundation of community wellness and health, and this is just a component of this process. The relationships that are built are going to be vital to this, as Chief mentioned. I know from our perspective, it's truly important for the right people to be doing the right jobs at the right places at the right time. We, as police agencies really across Canada, have inherited a lot of jobs that should be done by others because of the fact that we are available 24/7. I've witnessed that in a couple of different provinces and somewhat similar. So I huge supporter of any type of community mobilization, crisis diversion of any of these programs, vital to growing community safety. And I hear the word ecosystem. I always make the joke, I went to Nova Scotia University, graduated with a biology degree, and when I hear us talking about community safety as an ecosystem, I think it's fantastic because everything has to work together, and this is another piece of working together that's very clearly missing. And in the call diversion, the early intervention piece is significantly important to long-term success and safety and the reduction of crime and the reduction of community safety factors that are negatively influencing our communities. So, and I know that I believe so far, you know, after my short period of time here, I'll get into that a bit later, everybody can work together. It's clear from what I've seen. So I think it's fantastic. And I think from our perspective, you're going to see the huge engagement and support for anything that makes our community safer, and be doing it together. So.
Thank you, and welcome to the team here, Chief Duff. I just want to end with the relationships and this ecosystem that's starting to build is the key, I think, to the report that we as a Board of Police Commission received, which is the defund report. And I agree with my colleague, I prefer to use, it is called that, so we still have to say it, so we know what we're referring to. But in my mind, it's talking about retasking, and it's about building these relationships. We looked at a lot of those points at a board level, at a committee level, and so many of them were collaborative efforts that were going to have to be put together. In some cases, they were beyond the scope of this board, and it would be a collaborative effort of another group. Sometimes it would have, at some of those points had no police, it was a police involvement, but not so much even a municipality. It was very squarely put there with collaboration of players in the ecosystem. So this is exactly what this fund, this particular report, I think, had asked. The MCC Commission report has come out with finding other ways, and that's really, I'm just so proud to be part of the effort that is moving in this direction. I think we've already, lots of people had already put a few things, mobile crisis health team, for instance. That's another example of that kind of ecosystem. And we forget about that. That in fact was already in place. But from a perspective of what we're doing now, this is the right direction, and I applaud that. Thank you.
Final question from Commissioner Hinch.
Oh, there we go. So I totally agree with everything that everybody is saying. I hope that this is going to be a successful collaboration with all. My thing, and I've not heard time and time again, is the different groups, working groups, the funding. They're not being funded in a way that, that they can keep these programs going, or that is stressing them out. So I just want to make sure, as us as counselors, commissioners, and during budget, I'm thinking during budget, that we do, and I believe that you even said it yourself as well, the funding portion of it all, that to make it work, we need to look at how the funding is going and things of that nature. That's all I wanted to say.
Excellent point. Thank you very much. Can I ask one question? Just one little one. Just a comment, though. I mean, there is, I think, I'm so elated that this is going forward. I'm very, very excited by it. I think it is absolutely critical, and we need it to work. It's not the idea that we hope it will work. It absolutely must work. We need to do everything we need to do to make it work. And my concern was service saturation. Like, this is a pilot. It's not, we don't know what the capacity is that we need. We're getting 24/7 coverage, but that doesn't mean we have the capacity to handle all the calls. We're going to still learn that as we start to grow the service. And the support from the chiefs is critical to making sure the service doesn't implode in the early days. Just a question on privacy. Have you examined the privacy issues in relation to working with the police, working with your organization, your service providers? And the difficult question is, always working with the families. We met with some moms who had lost their children to suicide in 2024, and they highlighted the problems with our privacy laws in this province and trying to deal with that, and the necessary legislative changes that were required. Can you just comment on that lens has been considered as you design the program?
Thank you, Chair, for the question and the support. I appreciate it. So we're in the process of developing our policies, and they'll be reviewed internally by our privacy officer. I will say again that our approach will be to share as little information as possible and to treat each call as a unique call. And I think it's important to remember our scope and mandate. So this service will not be doing case management and providing that ongoing care that may, be better done by service providers in the community that are funded to do that. This service is meant to provide immediate short-term de-escalation of a situation and help that person get connected to a place that could provide more long-term support. So the amount of information we'll actually need to do that intervention should be minimal. And that's a big question that we have asked others around the country who are doing similar services, and that's the advice that we've received as well.
Excellent. Thank you for that. And thank you for your presentation. All right, Madam Clerk, we'll move on to item 8. Is there any correspondence, petitions, or delegations?
Chair O'Malley, the clerk's office did not receive any correspondence or petitions for this meeting.
Excellent. And I guess no presentations. We'll move on to item number 9. Information's brought forward from previous meetings, and that relates to Commissioner Mancini's request for the police response to hate crimes and hate incidents in Halifax, HRM. And we're going to have a presentation by Joanne Smith, Research and Development Coordinator, and Madeline Goldsmith, the Diversity Officer. Thank you.
Maybe as they're queuing up, if I could just have 30 seconds, the reason I asked this to come from just an information report to have a discussion and a presentation, and I thank you for the presentation, is that we're a growing municipality, right? No secret there. One of the fastest growing municipalities in the country. With that comes a lot of good. And the diversity that we see in our city now is like we've never seen before. And we see groups like the LGBTQ community grow in numbers. We see the diversity of culture from countries from around the world. We're seeing different faiths from around the world. And a lot of these groups are the groups that are on the receiving end of these hate crimes. So that was the rationale, Mr. Chair, of wanting to have a very good report, to have a presentation so we can have further discussion, just to set the stage. Thank you.
Thank you. Good afternoon, Mr. Chair, and through you to the Commission. Thank you all very much for the opportunity to present today jointly, HRP and HRD, on the police response to hate crimes and hate incidents in Halifax. Please don't be alarmed by the fact there are 3 of us. We intend to keep it short. We have a stopwatch going and we will be succinct. We'll do a short introduction and then move through the slides. So my name is Joanne Smith. I'm the Research and Development Coordinator for HRP. I've been with HRP since 2018 and moved into this position in 2021, and working on the response to hate crimes and incidents for HRP was the first large strategic initiative that I worked on. I'll hand over to my next colleague.
Corporal Marty Fetterman, the RCMP. I'm the hate crime coordinator for the division, and I've been doing that for about 1.5 years or so.
Hi, everyone. My name's Madeline Goldsmith. I'm the Diversity Inclusion Officer for Halifax Regional Police. I've been doing this role for about almost 3.5 years now. With hate crimes, I don't actually work in the hate crime unit. I work to support it, so I do a lot of the community outreach pieces with with Joanne Smith, and also with our detective Jeff Pache, who's the hate crime investigator.
Yes, unfortunately, we are missing Detective Constable Potier today. He sends his apologies. He wasn't able to make today's date, but I will be covering his slides for him. So just before we start, obviously, there's not going to be any graphic detail or descriptions in this presentation, but we do recognise that the general subject matter can be difficult for people. So if at any point we need to stop, please do let us know. So the timing for this report was discussed and agreed because of recently released national data, and obviously the rapidly changing international political landscape. We felt it was timely to bring this report forward to the board and update you on where we're at in relation to the police response. So this first slide just speaks to the overall general impact of hate, which is very much a global problem, and it's also a unique type of hate crimes and incidents are because they target not just the individual but the broader community which they believe, the perpetrators believe, that individual represents. The effects can reverberate into the broader community, and they can leave people feeling extremely unsafe, vulnerable, stressed and isolated. Just to ensure that we're all on the same page with the with understanding the definitions that we're using. We define a hate crime as a criminal offence committed against a person or property that is motivated in whole or in part by the suspect's hate, bias or prejudice based on the victim's real or perceived ancestry, race, national or ethnic origin, language, colour, religion, creed, sex, age, mental or physical disability, gender identity and or expression, sexual orientation, or any other similar factor. That last part, the other similar factor, that's there to ensure that the list is not exhaustive. It can encompass characteristics such as a person's political affiliation, their socioeconomic status, or their profession. With regard to hate incidents, these are essentially the same behaviours with the difference that they do not cross over that threshold into a criminal act. So an example of a hate crime could be an assault during which religious or racial slurs are used, and an example of a hate incident could be someone being told to go back to their country. This slide covers the law around hate crimes, and it's important to think of these as a crime type, a bit like intimate partner violence. So it's a crime type or category that multiple different offences can fall into. Any crime really has the potential to be motivated by hate. So the Criminal Code addresses hate crimes in two different ways. There are 5 specific hate-motivated offences, and those are listed at the bottom. And for all other offences, which is the vast majority of the offences that police deal with, the hate element can be taken into consideration upon sentencing. So the most common offences being property damage, uttering threats, criminal harassment, and assault. If a person is found guilty of that and the hate element is proven upon conviction, then the court is bound to consider the hate element when they're passing sentence. So recent data showed an increase in police-reported hate crimes, and it's important to note that these are police-reported hate crimes. So these are ones that have come to the attention of police and have been subsequently assessed and decided that there is sufficient information there to either confirm or suspect a hate motivation. So that's not all the hate crimes. These are just the ones that are coming to the attention of police. So data from Statistics Canada shows that the number of police-reported hate crimes increased nationally by 32% between 2022 and 23. That was the third sharp increase in 4 years and doubled the overall number since 2019. In HRM, that number increased significantly in 22 and 23, and Nova Scotia became the province with the highest rate of police-reported hate crimes in the country in 2023. Hate crimes are significantly underreported, so this data should not be considered as reflecting the true number of hate crimes which occur in HRM. Again, just to confirm that considering the heightened geopolitical tensions and the changing international landscape with regard to equity, diversity and inclusion sentiments and initiatives, that's why this report has been submitted to the board and community members to inform you of the police response and approach in this area. So the next 4 slides include 4 different charts from Statistics Canada. This is the number of police-reported hate crimes in Halifax, and you'll see that for 22 and 23, the numbers rose sharply to 72 and 121. It's with any increase in a crime type, the reasons can be extremely complex, and it's never possible to identify with certainty what the causal factors are. But you are going to hear about the efforts in this area by both agencies, and it is reasonable to infer that that has contributed in part to this increase. So this next chart shows, again, a significant increase, and that's in the rate per 100,000 population in Halifax. This is the number of police-reported hate crimes by municipality. Halifax can be found 8th from the top, with the other municipalities above it going from the top downwards being Toronto, Vancouver, Montreal, Ottawa, Gatineau, Kitchener, Cambridge, Waterloo, Calgary and Edmonton. And this is the rate per 100,000 population by municipality, with Halifax being 5th, and going from the top down, Kitchener, Cambridge, Waterloo, Peterborough, Ottawa, Gatineau, and Kingston. So this slide shows additional HRM data, and this is the number of police reported hate crime files where charges were laid. So that's between 2022 and 24. So the most common charges that were laid were assault, mischief, property damage, and uttering threats. Where a hate crime is recorded, but there are no charges laid, this could be for several reasons. The most common reasons for this are that no suspect has been identified, such as, for example, hate graffiti, which is a very common hate crime and one where it's unlikely to be able to identify a suspect, or not as likely as in some other crimes, followed by files where the victim does not wish to proceed with charges. So some additional data for HRP. Hate incidents, because these are not criminal offences, these are not covered in the hate crime data that's reported to Statistics Canada. Between 22 and 24, HRP and HRD have recorded 742 across HRM, with 711 of those recorded as occurring within HRP areas. In terms of which groups and characteristics are targeted across both hate crimes and hate incidents in HRP, the most targeted characteristic is race. That's in line with trends seen nationally, with hate towards Black, South Asian, and Arab West Asian groups being most common. Hatred towards actual or perceived newcomers, xenophobia, is the second most targeted characteristic, followed by sexual orientation, religion, and gender. In terms of location types, for both hate crimes and hate incidents in HRP areas, the most common location type is public areas such as streets, parking lots, and parks, followed by residential dwelling units, which can often be neighbour disputes, transit locations, and schools. So just to move on to the HRP hate crime unit. In January 2022, this was implemented, and it's located in the Integrated Criminal Investigation Division, and it's currently staffed by one HRP detective constable position. Some of you will recall that during the 24-25 operating budget process, a second hate crime unit investigator position was approved. The hate crime unit is required to review all files with a suspected or confirmed element of hate motivation. And the total numbers of files reviewed by the hate crime unit since 2022 ranges between 200 to 300 per year, and that's for both hate crimes and hate incidents. Out of those, it should be noted that about 10% are reviewed, and it's concluded that there's no evidence of hate motivation. So again, that's about 10%, but something that still adds to the workload of the unit. In terms of training, in early 2022, when the hate crime unit was implemented, HRP embarked on an extensive internal online and in-person training program for both sworn and civilian members, including frontline positions of patrol, CID, and call takers and dispatchers within IES. This remains an ongoing process, with the content being refined and updated as new and relevant information is received, including through the community outreach aspects. All new police recruits and all new IES staff receive training in this area, and targeted sessions have been delivered to newly promoted supervisors and community response officers, so those overseeing the response and those who are most likely to take a report within the community. The policy on hate crimes and incidents was issued in June 2022 and stipulates that a general occurrence report, a GO report, must be completed for all crimes and non-criminal incidents where hate is confirmed or suspected to have been a motivating factor. These are then referred to the hate crime unit, so they may provide advice or assistance as required, and if appropriate, if it's one of the, say for example, one of the 5 specific hate motivated offences, then the hate crime unit will assume carriage of the investigation. They would also contact the victim and offer or direct them to support such as victim services or other supports that they're aware of within the community. And where a file is charged, the hate crime unit will liaise with the assigned Crown prosecutor to ensure that it contains enough evidence to support the hate motivation element, should that proceed to conviction and then sentencing. Thank you, and I now pass over to Constable Goldsmith.
Yeah, so just 2 slides here just to talk a bit about the community outreach we did, and that is still ongoing. So, as Joanne Smith said before, hate crimes are probably one of the most underreported crimes out there. So, the stats are pretty scary if you start to think of it from that perspective. We really are looking at the tip of the iceberg. And from the community outreach and the conversations we've had in community, there are huge varying factors which contribute to the underreporting. And this is just a list here of some of the ones that we've heard. This is not extensive, but sometimes community members won't report because they're desensitized to the behavior. They actually feel this is normalized behavior, and it's alarming when we talk to communities and we start talking about what a hate crime is under the law legally, and the response from some community members when they're like, oh, I had no idea that that was a hate crime. I just, that's just behavior I receive so frequently, it's normalized. We have heard a lot about retaliation as a huge reason folks don't want to report hate crimes. This particularly happens in the newcomer communities who are, oftentimes living next door to varying people they don't know, people who don't know them. And if they receive behavior from neighbors, from folks they meet, they simply don't want any trouble. They don't want any retaliation. So it's a very common sentiment we heard. And then obviously one of the big ones is lack of trust and confidence in police. So this is a trend we heard from a lot of our communities here locally who police have had a longstanding history with. This is a piece that requires relationship building to fix, right? To rebuild trust. We also hear it a lot from newcomer groups who may have perceptions of police they bring with them from other countries, which is a huge factor. So, Joanne and I, when we first started the outreach back in 2022, we really were. It was really fascinating to talk to all these different communities about the various things that affected their ability to or their comfort and ability to share this information with police. We did start this consultation process in 2022. We really wanted to go out there and start talking with community leaders about what it was that they were experiencing, how hate crimes affected their community uniquely, because it's very unique depending on the community. And one of the major things we wanted to learn from community as well is how do we increase that reporting, knowing that hate crimes are underreported at such large levels. What can we do as police to increase that sharing of information? We heard a lot of different feedback. Some of that feedback we've used directly into some of the tools we have with information sharing. So we added some stuff to our website specifically on hate crimes, so folks can go there and read about the law and understand it with a little bit more depth. We created kind of what we call rack cards, which I think everyone might have a copy of. And this is just some very, very basic information to try to share with police or share information on what a hate crime is in its most simplest terms. On the back, we wanted to put Crime Stoppers because that's one way for folks to be able to report a hate crime without actually having to connect with police directly. So just another way to try to reduce that barrier so that at the very least, we can start getting the information. And as Joanne also referenced, we've used a lot of the stories and the insights we've learned from community to bring into our training. So we can bring directly to our officers some of those experiences that people in the community are facing and experiencing all the time. And that's quite eye-opening. It's a tremendously valuable tool for us to try to impart to our employees the seriousness of these crimes and how they affect folks. When we did the initial community outreach, and we really wanted to try to talk with those leaders first, and then leading out of those conversations we've had with communities has followed a series of information sessions. These have been mostly at the call of community. Community, when we initially talked to leaders, just the information, the lack of understanding of what a hate crime and hate incident is, that information alone was really valuable. So following consultations, and as we talk more and more with on different platforms, even different forums about hate crimes, we get requests to do information sessions, and that usually Jeff Pache and I do a lot of those. Joanne Smith, I know she's very busy. She's joined us on many as well. And the information sharing piece is huge. This is ongoing. We're not going to stop. So if a community ever reaches out to me or Jeff, we'll find a way to make sure we can do that outreach piece. And it's, like I said, it's ongoing. And some of that has also led to some really great collaboration with HRM. Last spring, we did a presentation to the DNI office on hate crimes and talked to them about our unit, what we're doing, and that opened a lot of doorways into community to have further conversations. So the hope is that, you know, we can build on that partnership with HRM, with the DNI office, and some of the broader work that community is calling for, which doesn't actually fall on police to do, but is a broader collaborative effort that needs to happen. I think that's about it. Got myself off there. Hand it over back to Joanne. Oh, over to Marty.
So my, being the coordinator, the main goal or the things that I'm doing is obviously dealing with the community groups throughout the province, because it's not just Halifax itself, it's outside, so it's much larger. So doing it myself, I basically just provide the expertise and give some advice to the individuals on their files so they can conduct them. So a big part of that, also, even in trying to get around the province, is setting up teams, meetings, and presentations. So that's all about hate crimes and whether or not it's from the federal. Our national headquarters has a lot of experts as well. So we produce that and have that give out to the membership. So part of that goal at the end was just giving a guidebook for the officers so that the officers have the ability to do the criminal offenses on hate crimes. That was that part there. So another part of my role is looking at the files on a daily basis and just trying to see what the trends are that are happening around the province in regards to the files. So Halifax, and then outside of Halifax is unique. We get a lot of, from the outside, we're getting a lot of mischief in graffiti, which is being noted. So after doing a little bit of analysis, I'll then go into the files and I'll talk to the investigator, give them some advice as well. So one thing that I noted actually is the fact that we didn't have as much community involvement. So started reaching out to the communities. And one of the goals was, or what I had heard was they were being notified in advance. So what we had done through our Stratcoms and our media is get a hold of the community members first, advise them of maybe a hate crime incident, and then they're aware of it, and then a media release would be going out. So in advance of the incident itself on the media side. So we would do that. And from the communities, several of them have said that they really appreciate having that advance notice before it got into the media. Not everybody has that ability. The RCMP, we obviously have a specific internal policy on the hate crime, and it ensures for the public is aware of this. So it's online as well, outlines the key information, and includes the section of the Hate Crimes Task Force, which is co-chairs with Canadian Race Relations Foundation. This task force has developed a pamphlet which we can produce or provide, and it goes right across Canada. So there's a diverse membership through this task force, which creates all of the information that we need to use going forward in policing and for the RCMP. The other part is, another part of my role is I collaborate very closely with HRP and Jeff Pache, and we actually discuss the files because sometimes they're in the area, or maybe the victim is in Halifax, but the accused is outside of Halifax, and vice versa. So we have a great collaboration there and speak about the files. That's pretty much it. Any questions?
Excellent. I'll open the floor to questions from commissioners.
Please.
Commissioner Mancini, would you like to go
Thank you,
first?
thank you, Mr. Chair. Thank you, the three of you. Thank you for the work. You know, you started off, Joanne, with the global problem, for sure. And I guess my first question is, have we seen an increase in this hate crime activity when we look at our neighbors to the south and what's happening there? Because we, the president himself said there's only two genders. I mean, the president himself said he's cleaning out the armed forces of people of the LGBTQ communities. And so we're seeing that kind of activity in the most powerful country in the world, to our neighbors to the south. Does that almost allow people that have those same opinions and maybe kept them to themselves to actually now share it? And my second question is, you answered a lot of it about the unreported, and as I'm looking for what can we do as a community, as a Board of Police Commissioner, I wear my other hat as a municipal councillor, what can we do? To hear that hate crimes are underreported because it's feel to be normalized behavior, is unacceptable. The lack of trust in police, that can be a cultural piece because of where folks come from. I think you alluded to that. And I'm glad to hear about the outreach. So have you gone into working with ISANS or the Muslim committee and such? And if there's a way to help, I'm happy to facilitate those kind of connections too. So those are my first two questions.
Thank you very much, Commissioner, for the question, and through you, Chair. So what's happening across the world is, and anecdotally, obviously, for everyone, it feels like it's legitimizing hate speech and making people feel empowered to, especially within echo chambers, and it's people are being bolder, it feels. In terms of the official statistics around that, the ones for 2024 haven't been published yet, and they will be coming out in this summer. We expect them to actually probably stay about the same, but obviously 2025 is where there's going to have been the biggest impacts, and that we won't see until next summer. In terms of our local statistics, we are seeing things start to plateau a bit, after those rises. There can sometimes be responses in the data due to that correlate with global events, but again, we aren't able to say that there are direct causal factors there. So I don't know how much that helps with the question, but yeah.
I think I know the answer anyway, but
yeah. With the to your second question, I'll probably let you speak to the outreach with ISANS and the Muslim community.
Yeah, absolutely. And yeah, we've done some great work with both of those groups, a lot of other groups as well. So ISANS was one of our first outreach groups for consultation. We did a high-level consultation with ISANS, talked about, the basics of what a hate crime is, hate incidents, and then walked through what our response model is, and then how can we support them as a group that is the major supporter of newcomers in Halifax. And after those conversations, we then went on and did some more information sessions with their staff, because sometimes staff, and this is not just ISANS, but many service providers will, as they have clients and they're working with different clients from different groups, will hear them talk about their experiences and maybe identify some things that could come to us or could be reported to police. So that conversation pretty much we've had with many other service providers. I'd love to just answer also anecdotally your question on geopolitical issues. They impact tremendously our local politics, our local communities' experiences. There has been an increase that we hear about some of the alt-right groups that are more loud, perhaps not more in numbers, but certainly more loud, which it can certainly impact the stats on things like reported graffiti and such. I can tell you, I do connect with a number of different policing groups nationally. Some represent, the 2S LGBTQ community, for example, and there is a general sense of fear from those communities. I think maybe some of that's changed based on the election that just happened, but there was a lot of anxiety that's been brewing in the communities here locally too. When I talk to community partners, they tell me about a lot of fears they have on their safety and the emboldened voices that show hate towards their communities. So yeah, it 100%. Even nationally, our own politics affect this as well. When immigration policy changes, that has huge local impacts. So our students who are from out of the country who are here in Halifax, they are facing increased pressures, and they also receive, increased isolation as public. And I would say it's social polarization that's really happening on a national scale here, internationally as well. But the social polarization really, really is a driving factor for increase in hate and hate sentiments, right? So it's sad to see that politics nationally, geopolitically, are kind of moving to that polarized state. It makes our job much harder. So that leads kind of into your question on what can you do as people who are trying to support your communities. I would say a unified messaging from our politicians, from our city council, from our city, which I think I've heard a number of times that kind of unified idea that hate crimes, hate is not acceptable. We support equity, diversity, and inclusion. That messaging's been very strong in our city, which means a tremendous amount. And I will reference to some of the conversations we've had with our communities that have said, this is what we want to see happen. Some of that stuff is about, what is being done to share information outside of marginalized communities. So the general public, what are we doing to inform the general public on what hate crimes and incidents are and how their behaviors can change, right? We focus a lot on the marginalized communities, but how are we spreading that message further? So maybe a campaign. And I think partners like the Halifax Immigration Partnership, they're considering this kind of work to try to work with service providers, with the city, with our city service provision on seeing if we can find that kind of work. Is that something? It's beyond the scope of policing. We can't necessarily drive those things, but this is what community's saying and asking for. And I would encourage everyone here too, and just to go back again, we did an information session with the Dartmouth Masjid, the Dartmouth Mosque, and they invited us to have some conversations, some information, share information on hate crimes, and they purposefully invited some of their councillors, MLAs, MPs to this information session. So what happened at the end of that was not just us sharing information, but community then sharing information back, talking about their stories and experiences. And we had these incredible conversations around what are some of the stressors that the city is also putting our communities into conflict with other communities, right? That intercultural community conflict can 100% be looked at from an HRM lens. So, I would encourage you, if you have opportunities to talk to your local communities, do it, because we've learned so much, and that's helped informed our process. But yeah, there's a lot of stuff that others can, that work that falls outside of our scope, but can be learned about as well.
Thank you. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Bezic-Escalard.
Thank you, Chair, and thank you all three for all your strong work on this. It's a very difficult topic and a sad topic to know this is an issue in our community, of course. But to hear all the work that the three of you are doing, I'm heartened by the fact that you're all clearly HRD and HRP are taking this issue very seriously, and I feel heartened by that. I have a kind of a technical question about the process, and I'm acknowledging that the hate crimes are all within the integrated CID. So whether it's HRM or HRP or HRD, that should all end up in the same place. My question is about the hate incidents. So it is HRP policy to create a report for every hate incident, and that's where we're getting some of our numbers from. I'm just wondering if you could elaborate a bit more on the process for HRD. So I know your position is specifically a provincial one and that you're the SMA for the province, but I'm wondering if you can give us some sense on how those are treated when they happen within the HRD covered areas to feed the
Yeah,
system.
it's very similar. They're still on the same Versidex system. So generally what happens, it will go into the database. I'll be notified. And even with my counterpart, Mr. Pache, he's not here, but he would notify me on an incident that's occurred and we would take a look at it.
Okay.
So that's basically,
So it is seen.
it's on the same system.
It is, okay. Perfect, thank you. And just to follow up, as far as location, so you went over, Joanne's, about the different locations that happen. Is there any particular hotspots that might be of interest for the group here? Over?
No, not that we, other than general location types, not that we have identified. It is something that is reviewed occasionally, but also where so many different demographics are included in the overall hate data that we have. Sometimes the numbers are just too low, really, to consider them as a hotspot.
Great. Thank you again. Appreciate it.
Just a quick clarification on the data. None of the data that you showed today, though, is related to hate incidents. These are all hate crimes, correct?
So most of the charts that I showed you from Statistics Canada, they are all hate crimes.
Right.
And the ones where it showed the charges, they are all hate crimes as well. And then on the there's one slide with narrative that talks about the number of hate incidents in yeah.
Okay. Commissioner Akidoshu.
Thank you very much for your presentation. I would have loved to hear a little bit more about prevention, not proactive. I mean, I'm a clear victim of hate speech, this or that. Even on golf course, people ask you silly questions and you feel hot about it. How do you plan to prevent? It's quite expensive to prevent hate crime. Through schools, advertisements, and billboards, and that. And I think that should be the trajectory that we should follow. Let people hear what they say hurts other people. Correct? Thank you.
Yes, correct. And thank you, Commissioner, and through you, Chair. Some of the work is, while reactive, it's also preventative in what is done in, for example, the policy changing to capture hate incidents. They are the largest proportion of the overall data. And the purpose for making that policy change was for several reasons, some being to identify particular areas that were potentially facing being targeted more than others, so that community outreach could potentially be done there to make people aware and increase sort of education in that area. Also to identify if there are any individuals that were coming to police attention for having a particularly hateful attitude on more than one occasion. That by having hate incidents recorded, that possibility was increased. And if it was appropriate to look at potential intervention, then that's something that the hate crime unit could potentially look at. In terms of the community outreach, we take the information from them to try and understand where work around prevention could potentially be done. And for example, we hear a lot of feedback about doing work in schools and reaching children at an age where they are most impressionable and influenced. That's something that has been explored, and Constable Goldsmith has worked with the HRC schools officer, the diversity and inclusion officer, but it's proved a little challenging to sort of create a coordinated approach with in terms of any prevention that could happen there, but those connections are in place. And so yeah, I don't know if that answers your question.
You have, yeah, thanks.
Commissioner Kent.
Thank you, Mr. Chair. Thank you for this presentation and the work that you're doing. I have a number of questions, so I'll start with it's an easy one. The Hate Crimes Task Force, do we have representation on that? Is that something that we're connected to? Short
So
answer, because I got other questions.
it's co-chaired by RCMP, and HRP Superintendent Dave Boone, who was here, is on the task force.
Wonderful. Really glad to hear that. The next thing I want to talk about is the importance of the money we spend in schools. We still see very deep-rooted, biased hatred and racism in our communities. It's still here. It's a learned behavior. Our children don't start out like hating things. They start out loving things. And local schools, middle schools in particular, and elementary, spending any penny we do in there is worth so much. We're growing humans into good adult parents, and that will continue. Social media is not helpful, as we know. And we have a new generation, or several generations, but certainly now that is social media is their go-to tool for life. And we know that there are huge players in those games that create algorithm that feeds those hits in your interest or whatever. And I wonder if this task force is giving any thoughts to legislation or any conversations around that kind of tool that's out there that we're all battling. We're battling as parents, we're battling as humans ourselves. We also can, as adults now and leaders now, we rely on our phones and those social media platforms to share information. So I'm wondering about that. And I'm glad that my colleague asked the question around the reactive versus proactive. I think you answered most of my questions in there. The only other thing I have, and so I'll add that as a question, then I'll be done, Mr. Chair. When you talked about sharing information to maybe groups, culturally relevant groups, or diverse groups, how do you balance out an investigation of a critical incident? So, for instance, a death, and it could be a hate crime, but you don't know until really you get all the facts. At what point, I'm just curious how you balance that, because again, got back to social media, there's things, the minute something happens, people know about it. You have an investigation to do that is tight, and you need to keep it tight for all the right reasons. But information is flying all over the place out in the rest of the realm of the world. And so some of these groups probably are hearing it and then wondering, is it true or relevant? Do you have any information that gives you that insight? And they might be asking you, so how do you balance that? Does that make sense?
It does. Thank you very much for the question, Commissioner, and through you, Mr. Chair. So in regard to the Hate Crime Task Force role in the legislation, so the task force did have a significant role to play in providing input for the Online Harms Bill C-63. So that unfortunately died on the order paper in January when Parliament was prorogued. But it had reached its second reading in September, and that is due to create a number of online offences which specifically are targeted at protecting children, and it also would have created a standalone hate crime offence as well, and also had targeted provisions for freedom for hate speech. So hopefully that bill can be resurrected. It did have a lot of discussion, lots of debate around it, but we don't know what will happen with that. But yes, the Hate Crime Task Force did have significant input into that legislative
Good.
discussion.
Good to hear.
And I'll pass you over to
Schools?
Constable
Yeah.
Goldsmith.
Yeah, just to try to answer, I think your question on how do we do these investigations that are kind of complex and kind of peel out the pieces of hate that are that appear in them. So maybe just speaking a bit about the process would help to clarify this a bit. So when a hate motivated crime is reported, so let's say graffiti that is hateful is put on a business, that's property damage first. And that initial investigation will be done by a frontline police officer. So an officer will be dispatched, they'll investigate that, the property damage, gather evidence, video, statements, all that. Jeff Pache, the hate crime investigator, has additional training. He's received huge amounts of training on hate crimes, how to prove them, how to get statements from folks. His job is then to come in and talk to the victim, get a secondary statement, and really outline the hate crime offense that has occurred. And so that way you almost have these kind of two overlapping investigations happening. The initial one, which gathers all the grounds for the crime, and then the hate motivated piece to it where we prove the motivation. So that's a very simple kind of way to kind of understand how the investigation goes. Obviously, sometimes, we rely on our officers also identifying that there is a hate motivation happening. And certainly in the beginning, when we first started the hate crime unit and gathering hate incident information and really started going after hate crimes as a criminal charge. That was a learning curve. So our officers are, have gone through the training to identify it. We still have a way we still do crime analysts doing searches. Yeah. So we also have a crime analyst who will go periodically and search through all the files with free text. So they'll look for different words, and we really try to comb through the files to make sure that we've captured. So if an officer has not noticed a hate piece to a file and flagged it for the hate crime investigator, we do have that secondary kind of way to catch it. Yeah, and I mean, there is online hate is a very complicated and challenging world to get criminal charges in. I wish Jeff Pache was here because he could probably speak a little bit more to the approach to those files. But the training that he has really helps him to go, and he'll embed himself in investigations. So if a larger scale incident happens and there's some reason to believe, and this has recently happened, that hate motivation is a part of it, he will embed in that file and follow it along, and he will interview suspects as they come in and such. So he is quite active in kind of the large, complex hate motivated files. Did that answer?
Yeah, it was very helpful. Thank you.
Thank you. Thank you for that presentation. So one of my questions is back to the online criminal activity that goes on there. Myself, I've dealt with quite a bit of hate crime, and I know exactly. For some reasons, I don't report it. I haven't reported it or anything of that nature. Like when I ran for council this year, there was quite a few emails that I received that were hateful, but you don't know if it's AI. You don't know if it's legit. How would you guys so I didn't report it. Do you think that's something that I should have reported? Or is it something that, I'm just like, okay, probably AI or a bot or whatever. But again, I mean, it was serious enough that the news got to me. But again, I'm like, I don't know how far to go with those type of incidents, for one thing, especially being in the position that I am and being a Black woman. The other thing is, so you talked about communities, alerting to communities when a hate crime has been that happen in the community. Can you speak to more about that as well with regards to who do you alert and how does that work and things of that nature as well, please?
Yeah, no, thank you for the question. First and foremost, this is exactly why we have some of the issues we have. You should be reporting it.
Yeah.
Regardless of small it is, the police aren't going to be aware of things or incidents. It may be minor, it may be nothing at all. It could be AI, as you're saying, or it actually could be some substance to it. So I just suggest that you do report if that's how you're feeling. The second part in regards to the communities is trying to establish a representative, somebody that's kind of trusted in that community. And it's not about fanning out a message of the hate crime, but just to establish a point of contact. We're trying to build some of those bridges sometimes in those communities where they maybe don't trust the police, as you're saying, or they've had bad experiences. But what I've kind of gathered from that is it's the opposite now, is that so we have there's a voice. We're communicating to that individual saying there was an incident, it's going to come out in the media. We thought we would tell you in advance, just so you're aware. And they appreciate that. So they're slowly building some of the bonds as well, right? So I try to go out to as many communities as possible. I know a lot of it is in HRM, so it's a little different for me, but in collaboration with the HRP staff as well. So we try to work that. I hope that answered the question.
It kinda.
Okay.
So the hate incidents, can we speak more to about the hate incidents as well? I would like to know a little bit more about, because it says that is not tracked. Is that correct? So what is a hate incident compared to a hate crime? And should they be tracked?
The difference between hate incident and a hate crime is that with a hate incident, there is no criminal offence. So a common example would be someone being told to go back to their country, so a hatred of newcomers, but there's no, without any surrounding behaviours that would cross the line into a crime, that would not be considered a crime, but we would still track it as a hate incident. And both HRP and HRD do track hate incidents. So they are tracked.
Just to add to that, so when you talk about it's not being tracked, she's talking about Stats Canada only tracks criminal. Stats Canada only tracks criminal incidents. They don't track things that are outside criminal incidents. So one of the things we did actually, because we've had a lot of experience where people will call us saying, a cab driver and someone gets in the cab and they slur him out because he's from wherever, in terms of calling the police. And at the end of the day, there's no criminal offense. Like it's not a criminal offense to be. Sometimes we say, it's awful but lawful. Like it's not a good thing, but it doesn't get to the rise of actually charging someone with an offense.
Mm-hmm.
But at the same time, it gets to the point where it needs to be captured because it may contribute to something else down the road, or maybe but so that's what hate incidents speak to, is that they don't rise to the threshold of actually you could not be charged for it.
Okay.
But at the end of the day, it's still something that should be tracked in terms of just the sense of, because it can be very damaging to an individual and a community based on whatever it is.
Thank you, Commissioner Mancini, and then Commissioner Akindoju.
Yeah, very quickly, just one question or more about the justice system. When there's a conviction of a hate crime, is the punishment stronger than a comparable crime that's not a hate crime?
So it's difficult to tell because it's not recorded nationally. The Federal Department of Justice did do a research paper on it, and they concluded that in many cases the sentence was increased to account for the hate element, but they noted that the courts were not saying by how much, apart from in a few very rare instances. For example, one sentence was increased from 5 months to 17 months because of the hatred towards sexual orientation included in that crime. But they noted that that was unusual for the court to spell out in their sentencing reasoning.
And Commissioner Akindoju.
Thank you. it's easier for me to describe love because love is easy to identify, but hate is very difficult to report. And I'll tell you why. I think the chief said it right. It may lead to more issues depending on how the recipient, it's just the way the recipient sees it. I can tell you my experience. At my age, I don't care what people say, but people say things that are just offensive that could lead to a crime because the way they say it and the way that you're receiving it feel it. So it's not a pain to anybody that is not receiving it, but really, can you feel what the person receiving it feels? That's the most important thing. We can all know what love is, and we feel love clearly. And the same way hate is felt clearly. The reason why it's not being reported is because it's just too many times, especially of the sports, kids' sports. I'm not worried about my age or probably our age. I'm worried about kids and how it's increasing from, generations downwards. So again, I think the most important thing is how can we prevent it? How can we educate people? How can we make people understand that love is great and hate is deep? It's just terrible. So it's hard to describe it except you feel it yourself. Thank you.
Just a question for you. In the numbers that were shared around the hate crimes, do any of those include actual online committed offenses? And then the second part I'd ask is that are there any any of those in those stats? Are there people who are committing the offense from this jurisdiction to someone in a different jurisdiction, or the reverse? The victim is here and somebody lives somewhere else, and those are being captured in that?
So in response to the online component, yes, undoubtedly there will be some cybercrime. So when we report our crime statistics to Statistics Canada, we have to flag them as well as hate crime. If there is a cyber component that is either technology as a target or technology as an instrument, then we have to flag it as cybercrime. And so that would be included in that. I don't have those figures, unfortunately, but if there are, that would be included in there. And my apologies, I've forgotten the second question.
I was just asking jurisdiction to jurisdiction.
So generally,
yeah,
to you is crimes are considered to be committed where they're received.
Okay.
So in terms of like threats, if you call from Toronto and threaten, if you threaten Marty from Toronto, the crime actually is considered committed here because that's where it was received.
Okay, excellent. And then just one last question related to it is, am I to assume that the majority of the offenders are committing offenses against, how do I ask this? Are there, for example, could there be new Canadians who might come from a different culture, who might come to Canada and have been brought up or thought that their words don't matter, and they come into our community and the words do matter, and it's a learning experience for them? Is there examples of that in these incidents? Okay.
Yeah, absolutely there are. And, I think also going back to intercultural conflict that arises within communities can stem from that particular issue. I have been involved in a number of those that I can, I can't talk about necessarily, but yes, absolutely. The perceptions and keep in mind that hate crimes are about the perceptions of the offender, right? What is it that the offender is perceiving, how they perceive the person. So there can be a hate crime against someone who doesn't actually identify with that characteristic. However, the offender thinks they are from that community or thinks they are. So yeah, how people, come to Canada, integration is a huge piece of those crimes. And I will add, I go back to this. This is some of the from what we hear from communities, especially newcomer communities. Intercultural conflict can also arise when there's resource scarcity and there's a competition for resources. So when we put folks into community housing, into different communities, and that integration piece hasn't happened, so they don't know much about the community they're arriving into, and then also they're fighting for resources alongside some of these longer standing communities. We actually can see quite a few flashpoints happen where this goes from two families side by side fighting to the entire community is involved. It spills into the schools. The youth are involved in these fights, so they can evolve into quite complex and far-reaching issues, and then also push forward ideas about newcomer communities. So they can be very complex how they arise, and they're also very complex on how to fix. Right? They involve a lot of resources working together. That's why some of our partnership with HRM is really, really valuable. We can have these conversations about where these issues are arising from, because and I think also what you're speaking to, sometimes maybe it's not going through a criminal justice system to fix these solutions, right? Mediation, restorative justice. I've been a part of at least one restorative justice hate-related crime. Remarkably effective, way better than charging someone and maybe putting them on a probation or whatever. So the transformative pieces on the other ends can be very effective as well.
A 10-minute break, so we'll reconvene at 3:30 sharp. All right, thank you. We're going to resume here. And we are going to move on to item 10, which is the report from the chiefs. So I understand that Chief McLean is going to share a brief update at this time.
Good
Over to you,
afternoon.
Chief.
I'm done. Thank you very much. Are we going to wait for everyone to come?
I think we're going to get going.
We're good? All right.
Yeah.
So good afternoon, everyone. Chair O'Malley, members of the board, and everyone who's joined us today. I want to thank all my folks that were here. I think they may have left, that presented earlier and did a great job. And as well as Dr. Siciliano for her report, which we waited for several times to get, but I think was obviously very informative. A couple things I want to note. So our recruit class for 2025 is scheduled to graduate next month on June 26th. I believe you should all have gotten or should be getting invitations to that. I believe that we got you a speaking thing there, Commissioner. What's that? You can say whatever you want. And so we're looking forward to that. We're continuing to process our applications for our next class in 2026, which will set to begin in the fall. We're currently at our security and background stages. I look forward to bringing actually some good news on that in the near future. I just don't want to jinx it yet, so we'll leave it at that. We also continue to hire through our experienced police officer program. And in fact, on May 3rd, I swore in 3 new officers, one from Calgary, one from Truro, and a member of the military police to join us. So we continue to do that on an ongoing basis. From a major investigations perspective, I do want to highlight the good work and the very quick actions of our officers and investigators on the 23rd who arrested the 16-year-old boy at 3 a.m. in relation to a threat against Citadel High. He was charged with a number of offenses, including promotion of hatred, weapons offenses, and threats. I did a news conference on that one as well, and in terms of it's a complex and ongoing investigation. And again, and I will reiterate in terms of, we get that, it's a very challenging and scary situation for some, but again, at the same time, I do express that, holding our compassion for folks is very important as we move that forward. As well, I'd like to, we charged a party last month in relation to a drug overdose, which had occurred back in November. Investigators charged Lance Rogers, 19, with manslaughter and criminal negligence causing death for providing the drugs that led to a drug overdose. So my thanks to the investigators who worked extremely diligently to bring that forward. And certainly our thoughts remain with the deceased and his family and loved ones. On another note, in terms of last week, we were working with our retail partners on the Spring Garden Road area. And we did a project and we're able to charge a young woman with a series of thefts related to a retail operation in the Spring Garden Road area. It's an ongoing issue there. We'll continue to do so in terms of she will be attending court at a later date, but it just shows we will continue our cooperation with the retail sector in terms of bringing some of those issues, which I know are an extreme, issue to them in terms of their operations. And as I do each month, as I address the gun violence in our city, I like to share our most updated statistics in terms of we remain at 3 homicides related to firearms in HRM in our area, the 8 shooting incidents, and we have had 115 firearms which have been seized in our area. I just want to give a brief update about our armored rescue vehicle, of which the board was heavily involved in terms. The closing date for the bid actually was yesterday. So that will be going forward, and I will bring information on that progress as that concludes. I believe it will go back to council at some point in the near future in terms for the tendering of the award. And as I mentioned at our last meeting in terms of our policies, on April 8th, we did add our Operation Breach policy to our publicly available policies in terms of, which is our policy around dealing with some of the high profile offenders that are on our list in terms of ensuring that they're abiding by their court imposed conditions. From a traffic perspective, HRP officers issued 1,219 summary offense tickets in April. 172 of them were for speeding. We had 31 charges laid for impaired operation of a motor vehicle. And this month focuses on motorcycle safety, where we remind citizens to wear their proper safety gear when riding and ensure their bike is in good working order, inspected, but also for everyone else to ensure that they share the road with our motorcycles and behave safely in terms of their operation. From a community perspective, May is Asian Heritage Month, and it's time for us to celebrate the rich culture, history, and lived experiences of our people of Asian descent. It was also National Police Week last week, which began in 1970 as a way for the police to embed themselves with the community and get a chance to see what they know. I actually was over at Micmac Mall for our display last weekend. It was a great event. Lots of our officers, our volunteers, lots of citizens that were there and engaged. My grandson loved it. So, thanks to all the officers and the volunteers who showed up for that full day to show the public what it is. Some of the things that we do, especially with our specialized sections. And I also, which is fresh in mind, I want to thank all the officers who worked over this long weekend in relation to the Blue Nose Marathon. It's a huge event, and the officers play an important role in ensuring the safety and well-being of all the folks in the traffic and ensure that the runners and the traffic stay safe, especially after events which have occurred in the world recently in terms of core security and responding to emergencies at the top of our mind. And I also, on May 1st, went to our volunteer appreciation night, where I got to award many of our volunteers with milestones for their time with volunteering with us. Like I said, in terms of, volunteers are a very important backbone of our operation, because it's those who chose to show up in terms of not the ones that have to. So they play a very important role. And as well, I throw a shout out to Teresa Trider, who was named our Volunteer of the Year for all the work that she does. I do want to take a brief note and just mention the passing of our retired chief, Don Boudreau, who passed away a few weeks ago. He was the last Halifax chief, actually, prior to amalgamation. Commissioner Moore and Chair O'Malley were both at the funeral. And like I say, and the comments that were made at his funeral were certainly, he was an exemplary officer and just a true journalist in terms of his time as a police officer at the time. And lastly, I just want to say welcome and thanks to Chief Superintendent John Duff. We had an occasion to speak a few times and have a libation at one point in terms of we start moving forward. I look forward to working with you over the next little bit, and as well express my thanks to Don for stepping in and sitting at the chair for the length of time he did and to a seamless operation in terms of policing and HRM. Thank you. What's that?
I wanted to share a letter that came in relation to the incidents of April 23rd at Citadel High School that you shared with us. I think it's important to celebrate the community support in incidents like these. So I wanted to read the comments from the Halifax Regional Center for Education. It says, "Dear Chief McLean, I'm writing to express my sincere thanks to you and the Halifax Regional Police for your swift and dedicated response to a potential threat toward Citadel High School last week. Your leadership and support have been deeply reassuring to students, staff, regional staff, and the broader school community. The growing partnership between HRCE and Halifax Regional Police is incredibly valuable. The recent event underscores how critical these collaborative relationships are in the moments of crisis. The safety and well-being of the students and the staff are our highest priority, and your team's commitment to these principles was on full display. On behalf of all members of the Halifax Regional Center for Education, I offer my deepest thanks for the professionalism, compassion, and the care shown by you and all of your staff." That was from the leadership of the Education Center. So congratulations, Chief. Thank
I
you.
just want to add to that, just in terms, and it kind of comes to some of the things that we were speaking about earlier in terms of, we were talking about the schools and all the other, like, we're very fortunate here because there are jurisdictions where the schools and the police don't have a good working relationship. That is not the case here.
Yeah.
From the leadership down, in terms of we have a strong working relationship, and it is something I think for the board, that something not to be taken for granted in terms of, I think it actually is extremely important, and I think that letter just kind of highlights part of that, the reality of that.
It does, and that's exactly why I wanted to share it, because it was an important demonstration of the collaboration your team has developed with the school system, and it's a critical, important partnership. Any questions for the chief?
One quick one, if I may.
Yes,
Chair.
Mr. Mancini.
Chief, since the last time we met here, the Board of Police Commission, we had that terrible incident in Vancouver where there was the streets were closed and the person went on and killed numerous people and injured many. Do we have a policy here when we close streets? I mean, we're sitting right here. Every year we close Portland Street several times throughout the summer and the winter, and same thing in other regions. Do we have an actual policy? I recognize, I think it was the Ice Festival. I noticed at the end of Portland Street, we actually had a flatbed truck parked with somebody manned in that. I think that was something new. So do we actually have a policy that when we do close streets, we can prevent that from happening? And in this case, I believe, you know, if there was an emergency vehicle, that person's in there and can move it. So could you just speak to that?
So through you, I don't believe there actually is a policy in terms, I know we've started having discussions with the commissioner in terms of, you know, what does some of these things look like going forward in terms of, you know, safety around it. Well, you can, like, you know, like an event like, you know, like the marathon, you can't mitigate the risk for the
Right,
entire
right.
event, right? And in fact, you know, the Vancouver Marathon was the next weekend after that event there, but they took some extra measures around security, as they as we did here actually in Halifax in terms of, you know, hardening some particular areas and providing some other levels of security. But I think it is truly worthy of an ongoing discussion around special events. And I think, you know, I think Bill's already, you know, engaged in that discussion about moving this thing forward, because in terms, you know, the unfortunate reality is we live in a world now that's different than it was a while ago. And, you know, we got to make some decisions and about what does that actually look like for events, while at the same time making them accessible but safe at the same time, which requires a little bit of thought, right?
Yeah, and maybe that's something when we have a conversation with the work plan that we should look at some policy around that. Great. Thank you, Chief.
Commissioner Moore, would you like to add to
Yeah,
that?
just to add on to what the chief had said there. So as it turned out, there was a bit of a working group that was struck up before this happened in Vancouver. So we were already, and then as a result of that, as the chief mentioned, and I reached out to Superintendent Mosier. So we have both agencies in Special Events Task Force has gone back and reviewed some of their numerous events coming up to relook at their plans to say we need to put, but to your point around policy, that's what we're looking at, building that right now. Just saying, okay, what is it? What do we need to procure something? And we've actually have some information was shared from one of Chief from Superintendent Robertson on an event that he was at with CACP that talked about some other things that are happening. So it's, I won't say it's on its infancy, but we're on the trajectory, and we know that there's a more robust security plan needs to be done to make sure that vehicle-borne attacks are not part of it, at least try to mitigate the impact.
Commissioner Akindoju.
Thank you very much. And through you, Chair, to the Chief, I actually raised this question before, and I'll continue to raise it until we get an answer. And I know you do not have an answer. People
Well,
have.
it's good to know I don't have an answer.
Yeah, I know.
before I even hear it.
I know, but I'll continue to raise it. We continue to experience people driving, smoking cannabis. It has continued to increase. My question again is what, not just you, both yourself and the chief, RCMP, what can we do about this? I don't smoke cigarette, so I don't know what cannabis feels. But what I hear and what I know and what I've read is it also intoxicates, like beer or any form of alcoholic drink. If we police driving and getting drunk, or what you call it, drive drunk or drunk driving, why shouldn't we police? And I'm sure some of yourselves and your colleagues would have driven past cars or trucks that are totally engulfed with the smoke and the smell of cannabis. How are we going to eradicate this from our society? That's question number one. I was lucky to be in a community and around Clayton Park West, where I also live, Clayton Park West East, the whole of Clayton Park, you would agree with me that it's opened up quite significantly now. What they're asking for is they do not see night patrol anymore, leading to a lot of car breakthroughs, and people are getting afraid that this will lead into. Nobody sees that in Clayton Park in the past, but it's just continued to increase. This is just an ask that that area too is looked into, and I promised that I would share this with the chief during our meeting as well. So thank you very much.
Thank you, Commissioner. All right, now we get to officially welcome Chief Superintendent Duff, and maybe we could ask you to share a few words and introduce yourself to everybody.
Well, thank you, Mr. Chair, Commissioners. Really happy to be here. I won't I won't bore too many people with my history, but just some of my background. I was born in Halifax. Ultimately, my dad was in the RCMP. My mom was a nurse. Imagine that, a police officer and a nurse ending up getting together and getting married. My grandfather was a former chief of Dartmouth City Police from 1956 to 68. My mom's a graduate at Dal. So yeah, basically it's coming home for me. I was born in Halifax, graduated from Acadia, not to start any rivalries, but after that I got into the RCMP. Went to training and ended up in Manitoba for minus 3.5 years. The last 35 or so, I ended up marrying a nurse, shockingly enough, who is actually a nurse with a PhD in nursing, who teaches nursing but still clinically practices. Daughter 21 in university, son 19 in community college doing mechanical engineering. Very proud of them all. They've done exceptionally well. Really excited in the environment to be here. You know, the presentations today and the moving forwards collectively, I just see the unbelievable opportunity in community wellness, health, and safety, because it's being supported so widely by so many people within this area. Look forward to being a part of that. I've been welcomed so greatly by everybody I've met. Chief, his whole team. I'm fortunate when I think it's day 5 in the office. If I have a question, I can go over to Don, I can go to the chief, and everybody has given me the time and patience to listen to my questions and answer them. I can't think of a better environment to be in. So I'm really looking forward to it. At this point in my career, I'm very excited. And really, barring any questions, that's it about me. 35 years in Manitoba, a whole bunch of different communities, the isolated fly-ins, the large municipal, and some very diverse experience in various types of environments and communities. And other than that,
I have a question.
happy to be here, and I'm going to defer to Don for the report. He's lived the last while, and I want to recognize him, as the chief did, for the fantastic job he did and the support he's given me since I've been here. A wealth of knowledge, his experience in the area is going to be vital to our collective success as a policing agency, as a police partner, as an integrated unit with amongst police services and everybody else in community safety. So it's yeah, that's basically it in a nutshell. So barring any questions.
Welcome aboard. Did
Well,
I
thank you
hear
very
you
much.
say that you're rounding out your career and landing here for the end game? Because if you are, you need to know that we don't give you up very easily.
Well, I don't want to take up too much time. We've been here a bit, but generally, when somebody from our staffing talks about rounding out your career, they want you to go somewhere where you can only fly to. So this is a little bit different than that.
This is not that.
Excellent. So, Superintendent Mosher, would you like to share your update?
Thank you very much, Chair. Commissioners. I'm pleased to, on behalf of Chief Superintendent Duff and HRD, provide Chief's update for the last, well, since our last time together. Thank you very much for your kind remarks, by the way, both chiefs. I'll start off, put it in the category of recognizing our people, which I would say is a dotted line, obviously, to wellness. Timely recognition of the good work that's done by our folks should never be passed over too quickly. May 1st and May 2nd, our division hosted the King's Coronation Medal Investiture Ceremony and Award Ceremony. Those that have been in and around HRM for the last couple of years would recognize the name RCMP Constable Ben Bootlier. He received the King's Coronation Medal for his outstanding commitment as part of the RCMP's collective response to HRM homelessness strategy, which I think is a pretty good pick. Myself, I see a few heads nodding, in particular his collaborative efforts around supporting the Cobequid encampment in Lower Sackville. I'm also pleased to advise you the HRD team had received the Nova Scotia RCMP Commanding Officer's Certificate of Appreciation, and that's in recognition to the efforts displayed by our team supporting HRM's collective response to the 2023 Tantallon wildfires. So very pleased to see the detachment recognized for its hard work there. Also, I'd like to bring the board's attention to the RCMP's recognition of HRP Sergeant Jeff Carlisle, and we took an opportunity to acknowledge and recognize his outstanding contributions, Chief, promoting interoperability between both the HRP and RCMP emergency response team programs. Great work there done supporting interoperability and getting those teams working closely together to build resiliency for community safety. I'll move along to our HRD community engagement efforts over the last little while. May 13th to the 15th, the RCMP's senior leadership team took an opportunity to get together up in Cape Breton. We participated in some key strategic planning discussions, but we also benefited from a really unique presentation to do with the Gladue Court model, which was quite eye-opening. If you're unfamiliar with that, I encourage you to seek more information on that and how it serves the Indigenous communities in and around social reform and how that interlocks with the justice system. And also, we had some opportunities to do some continued senior leadership development. Great couple of days up there. Last week, HRD was also invited. It was a great opportunity, reverse community outreach to the HRD team to attend a community town hall in Beaverbank. There was over 50 community members at that actual town hall, and it really opened the door for some really constructive discussions related to some specific Beaverbank community issues, not all specifically related to policing, but some great feedback, but some good opportunity for us to get that real ground truth on what's going on in that community and the part we play in supporting it. So it was really wonderful to get that invitation and to be able to respond to that. You heard Chief McLean mentioned National Police Week last week. Thursday, May 15th, the Nova Scotia RCMP hosted its open house at our headquarters on Garland Avenue in Dartmouth. The HRD team was well represented there, along with our RCMP colleagues. But we actually had a really neat opportunity because we sort of linked up with HRM's community mobilization team, which you would have heard about today, and took an opportunity to kind of do a talking tour with them to help them deepen their understanding and perspectives on some of the support services and tools and programs and people that we have involved, not only within HRD, but more broadly within the division. So really great time with Raven and her team. It was wonderful. And of course, we had some time with our community members and volunteers while we were there. On Wednesday, May the 7th, reaching back there, we continued our detachment's community engagement strategy, specifically in the Middle Musquodoboit area, which is served by our North Central team. We were joined by about 40 community members our wonderful HRM community counselor from that area, and the one and only chair of the HRM Board of Police Commissioners made the voyage out there. And I thank you for your time to go out and do that. I know it was well received and important for us to see you there. Great feedback on issues of relevance to that particular area. But I'd like to note an excellent presentation provided by the Citizens on Patrol volunteer program, which was really wonderful, and how the community is mobilizing itself in support of public safety and how that's being replicated in different areas, not only in the north central area, but in Tantallon, Cole Harbour, and other areas of the province. Wonderful program there. Saturday, May the 10th, the Halifax Regional Detachment partnered with our North Preston community, starting to become a common theme. We work with them very closely, very often. And we participated in the annual North Preston versus RCMP basketball game. And I know our friends from HRP sort of helped us lift a line. I don't know if we got 2 lines out of that or not, but I called it an athletic spectacle. It was held at the North Preston Community Center, which was followed by a barbecue. And I am pleased to report that North Preston All-Stars delivered a decisive victory against the RCMP team. But most importantly, everybody had a wonderful time together with that endeavor. So commit to seeing that continue in the future. Yours truly, on another note, is now a member of the Canadian Association of Chiefs of Police Aviation Security Committee. Why am I mentioning that? Those that are unfamiliar, the Halifax International Airport is the only Class 1 airport in the Atlantic region, but more importantly, a key HRM stakeholder, and HRD serves as its police of jurisdiction. So through the collective efforts of that national committee, and of course in close partnership with our HRP Aviation Security Unit, which does a wonderful job, we're doing our part to help to influence and advance safety and aviation security out there. Those efforts continue. Some key operational updates. SAD report Monday, April the 28th. We responded to a single fatal motor vehicle accident in the Hammonds Plains area. HRD and first responder partners collectively responded and located an adult male driver who was unresponsive and having suffered from what we believe to be a sudden medical event there. So our thoughts, I know collectively, are with the family on that tragic event. You heard the chief talk about the Victoria Day long weekend. Our HRD traffic services and our general duty team were out in full force this past weekend in support of the Canada Road Safety Week. Exceptional efforts, I'm happy to report, from our team, having conducted multiple checkpoints and traffic stops. And that resulted, I'll give you a little bit of metrics on that. Over 2,000 vehicles were checked, by the way, last week. And that resulted in 115 traffic violations. And those were related to those primary causes of serious injuries and fatalities on our roadways. That is distracted driving, no seat belts, aggressive driving, but more importantly, the removal of over 24 impaired drivers from the HRM roadways. So some good work there. Obviously not limited to last week. Those efforts continue, but super important that we double down on those efforts to keep our roads safe. Last thing I'll mention, only for awareness, HRD is supporting the upcoming G7 economic ministers meeting being held in Banff, Alberta. And I mentioned it for transparency in that we're coordinating with RCMP at the national level to ensure a safe and secure G7. Our support, I want to assure you, is carefully being balanced with our local operational pressures with the unique security needs of that G7 summit. And I commit to saying no foreseeable impact to our HRP operations as part of that support, that short-term support initiative. So that's it for me. Thank you very much for your time and attention. Happy to take any questions or support the chief in any questions that you may have.
Any questions for either of our chiefs? Commissioner Bézek-Escalante?
Thanks, Chair. Superintendent, when you mentioned aviation security as well as distracted driving, it just triggered something that I saw in the news for all the chiefs. It was regarding the use of drones by Kingston Police to look for people who are using their phones. So not looking at what's on their phone, but still able to basically no different from an officer spotting someone through the window, seeing that they're on their phone. Is that something that has been considered, or is that something that is even feasible in our situation here? Over.
Thank you very much, Commissioner Chair, through you to the Commissioner. It's a fascinating area. It really is of personal and professional interest to me. And it's, nationally, various versions of how a remotely piloted aerial platforms are being deployed in support of public safety. Some are much further ahead than others, but we're pleased to report, at least divisionally, but even in HRD in particular, we do have that capability, what we call frontline drone response, in particular to support things like missing persons investigations, where we can add value very quickly before scoping out and deploying things like search and rescue teams, and then sort of pushing a lot of resources to a call. These things can add great value at the front end, but it's an ever-changing landscape. It's moving very quickly. The technology, we're kind of chasing it, but I'm extremely optimistic that we'll see that impacting public safety very quickly. I never thought I would see it in my career, so I'm very pleased to see it. There's a quite a spectrum of how drones can add value to things. I see the Chief McLean may wish to add some comments as well from the HRP perspective.
Yeah, we too similarly have drone capabilities for similar type of things. And there are some agencies in Vancouver, for one, that has a drone as a first responder in terms of actually a call goes, the drone goes first to see what's kind of going on. We're not there in terms of it. I also saw that article in terms of lots of pushback from the privacy folks around, but it speaks to a bigger discussion around, because I guarantee you there'll be a lot of pushback here too, if we did something like that in terms of moving things forward. It was an interesting, because I saw the article. It was an interesting. The chief was, it's no different than sitting up and looking. The other people were like, you're impinging on my privacy in terms of but again, speaks to anytime, like when we got our drone program up, one of the things that we had to do was a privacy impact assessment that went through our privacy folks and all those other things. So, but it is, technology is going to be quite the thing going forward in in all things, but particularly in policing.
Just want to say thanks for that. I wonder if that's something that we as a board might have to look at some point about policy, if that's even something we would look at as providing the overarching policy to cover that potential aspect, if it ever comes to HRM. All right, thank you, appreciate it, thanks.
It's an amazing technology. I've just seen some recent demos where they have drones that can go in and actually break the glass, go into the room, survey the room, so they can be part of an emergency response team. Like, the technology is amazing. And I was blown away by, trivia piece, I didn't realize that every drone emits a serialized signature, and that there are some cities that have equipment stationed to track the launching of drones, so they can track nefarious activity. They can pinpoint exactly where it left from, so you can see, if it's flying over what should be a restricted area, that they can follow it and track it. It's amazing. I must say, Superintendent Mosher, it has been a delight. I think you have been demonstrated amazing leadership on behalf of the RCMP's Halifax Regional Detachment. You've been a pleasure to work with, and I know we're going to continue to see you and work with you. But just wanted to say from the bottom of my heart, thank you very much. Yeah. These are real special.
Yeah. Don, it has been a pleasure. I just have a quick question. Has anyone heard from Jeff since he went up the mountain?
I have.
You have?
Yeah, we'll share that later.
Okay.
Yeah, the submarine has surfaced from time to time to survey, get regular updates
Good.
as
Glad
recently
to
as
hear
today.
that.
So he's doing quite well post his most recent adventure. So, and also pleased to provide his remarks in his regards to the board.
Yes, thank you.
So we're going to move on to item number 10.1 or 10.2.1, which is the Board of Police Commissioners 24-25 annual work plan and report and work plan. I'm going to ask Mr. Bates, Josh Bates, our policing policy strategist, to make a few remarks. And I wanted to just say that we're bringing this back to the board because we've had, some new members join the board. Some people weren't at the initial meeting where we visited the work plan. As everyone knows, we surveyed the board to collect input. Josh is now taking that information and reflected that in the plan. He's going to share a few comments, and then we'll look for a motion to put that on the floor. Or we could put a motion first. Okay. Would someone like to put a motion forward to Commissioner Kent?
Yes, thank you. I move that the Board of Police Commissioners forward the report dated April 24th, 2025 to Regional Council for information.
Excellent. Thank you very much. I'll ask Mr. Bates to share some opening comments.
Yeah, thank you, Chair. Josh Bates, Policing Policy Strategist, and I will be brief. So this is the first annual report produced under our new police bylaw. So there are some new components here that you wouldn't have seen in past years, including a message from our chair, an accountability statement, and also some high-level results from the board self-evaluation. In terms of the work plan, the board, as we heard from the chair, and as you all know, we've already considered an earlier version. So I'm not going to go through it in detail, but I will highlight a few areas that are new since the last version you considered in March, and this is based on your feedback. So these include action 1.6 to establish the principles of a 5-year growth plan for the police service. And also under the ADAPT pillar, you'll see several new policies articulated, including around the use of an ARV, which of course is on today's agenda, and also body-worn cameras. So be happy to take any questions that you may have.
Does anyone have any questions for Commissioner Bates? Commissioner Mancini?
Thank you, Mr. Chair. Josh, great work. I just want to make some comments that I'm pleased to see, and there's just a little bit of work ahead of us. That's for darn sure. I'm very pleased to see some of the things in here. The Wortley report, to continue to make sure that we're focused on that and reporting on that. And for commissioners, if you have not read the Wortley report, I encourage you to read it. It was one of the hardest documents I had to read as an elected official, and there was a lot of learning in there. So I encourage you to read the Wortley report. The body-worn cameras, I'm glad that we're in there. The root cause of sexual assault, it's really important. The role of police around homelessness, the RV, as you mentioned. Work on HRP policy on sexual assault case review, really important stuff. There's two things I have questions around. One is around public consultation and that engagement strategy. I'm wondering where we are from a time frame on that. We are looking to host public consultation, specifically on gender-based violence. So I'm eager to get that rolling. So I'm wondering where we are. And the second question is around the piece on the overseeing developments on recruitment. And this may be a question for the chief. You know, are we at a point in time we're going to have a conversation around paying our cadets versus our cadets having to pay to be part of the program? So those are two of my questions.
Okay, yeah, so I can certainly take the first one. So the engagement strategy, first, this is something that came up in the board self-evaluation, is an area for improvement, right? So we're doing, you know, a few things. First, we have the community survey on policing, which I think we should all be quite excited about. This is something the board has been requesting for some time. So we had an RFP as soon as the budget was passed by council, and we are now considering proposals. We have 5 proposals from across the country to deliver that community survey. In terms of on the ground in-person engagement, we've been working with I've been working with corporate communications for past 6 months or so on what a support model would look like, because this is a new area for corporate communications to be supporting a board, right? Normally they support, council as a whole. And we made some good progress in terms of what that's going to look like. Commissioner Moore, I don't know if you have an update on terms of where those conversations are with corporate communications that you could update.
Commissioner Moore, would you like to share a few comments?
So just in addition to Josh's comments, so we do have a position being transferred from the clerk's office, a vacant position, coming to the Office of Public Safety.
Okay.
Which right now what I'm doing, I'm looking at what the clerk's office is able to do to support us. Those are clerky things. What corporate comms is going to be able to do, and the delta in between is what I'm hoping to put into that new role.
Okay.
So we will have some support in relation to, Josh will have the lead in relation to the policy development, those kind of things. But there's another whole, as you know, a whole other piece of work around supporting of the board. So we think in discussions with the clerk's office that because of the unique nature of the board, that position will be able to, so we're going to custom make. So we're literally in the matter of looking at 2 documents to figure out the delta, and that will form the job description of that new support model. And obviously the commissioner will be involved when we get to that point.
Okay, good. Thank you.
Commissioner Kent.
Yes, thank you. So just help me
Oh,
understand.
sorry, my
Oh, you weren't
question, there's still the question of the chief on the recruitment. Sorry, Commissioner.
What was it?
So has there been, as part of this, in the work plan, it says oversee developments and recruitment. My question was around, right now, they pay to be in that program. Are there discussions about like other places where we're actually not charging them? In fact, we're paying them to take the program because I feel, I've heard, you correct me if I'm wrong, that sometimes limits who we attract for the cadet program. So is there a conversation about paying versus them paying?
I can say we've had some preliminary discussions about that. It's not quite as simple as just that.
I understand
Like,
that,
there's a lot of moving parts with that. But I know we've had some, fundamental, we have some initial conversations about what that looks like in terms of, moving forward. Obviously, there are budget implications.
Of course.
I was going to say that. Is that included in your budget?
Yeah, no, I understand
It's going
that.
to come back to the council.
Without question, I understand that, but I'm just wondering if there has been
Yeah, no,
conversations.
there has been, yeah.
And hopefully we hear more conversation around that. Okay, thank you. Thank you.
Commissioner Kent.
Thank you, Mr. Chair. Thank you, Josh, for the work that you have done on this. I can tell you that these updates and that our work plan and our strategic priorities look very, very different than they did in 2020 when I first joined the board. There is the outcomes and then the reports on what we've done so far. It's impressive, and frankly, we as a board, we work hard to get there. But Josh has been the lead on making sure all the little bits and parts are put together so we have this to always look to. And what I want to say is that particularly our new members, but all members, that we should be really looking at this report every time we come into this, before we come into this room, because this is the lens by which we should be looking at what we bring forward, what we're asking the questions on, so we can achieve our strategic priorities. And the importance of, for instance, this survey. So the update on the survey on engagement, just so I understand, Josh, is that the barrier? It's corporate communications to allow us to have that, or is that separate?
First, thank you for your remarks, Commissioner, and those are separate, right?
Oh,
so it's
okay.
two conversations happening. So one is, we had the conversation, regional council approved the
Yes.
budget for the survey, so that's going to be delivered in this fiscal year. And then parallel to that and separate from that is the conversation around corporate communications and getting more support from them.
Okay, good. And thank you, Bill, because I think that piece of that FTE that will align or be dedicated to our board is really a critical piece. When we think about the efforts that it takes for us to engage now, we could be doing it so much better. We could be much more supported, and Josh has really carried the load on things as simple as when we were having a refreshment on these long days brought in, Josh was the one taking care of it, and he's our policy advisor. It's not a good use of our efforts, so I'm glad to hear that that's coming forward. And regarding Commissioner Mancini's point on the I'm a big supporter of the idea of paying our cadets, certainly not having them having to pay to actually get to that spot, because they often are leaving careers and they need to be able to support themselves during that. But that's a huge, and as I think Commissioner Akindozier just said off the record, that's a budget decision, and then that's a big budget decision. So it'll be a bigger question, I think, for council to deliberate on, but we as a board would have to position it to go forward. So we have lots of work to do on that, but we also have lots of work to do on this entire work plan that we have. And I think we can be very proud of what we have done so far. So thank you.
Thank you. Any other questions for Mr. Bates on the 24-25 annual report and the work plan? Call for the question. All those in favor of approving all those contrary-minded? Motion passed. Thank you. Thank you, Mr. Bates. We have another item for you. All right, so we have item 10.2.2, which is an amendment to the Board of Police Commissioners policy on extra duty. Would we like for Commissioner to put forward the motion that's been presented, and then we can have a discussion on it?
I'll put that
Commissioner
forward.
Hinch?
Thank you. The Board of Police Commissioners for Halifax Regional Municipality adopt the amendment to Clause 6.3 and the inclusion of Clause 6.11 in the extra duty employment policy as outlined in the staff report dated April 29, 2025, revised May 12, 2025.
Thank you, Commissioner Hinch. Thank you, Commissioner Kent. Mr. Bates, would you like to give us a little intro?
Sure. Thank you. This is a simple amendment to ensure that requests for extra duty employment are made to the chief. And so this amendment would achieve two objectives. It would ensure alignment with the language in the Police Act, and it would also ensure alignment with the off-duty policy. And in addition to that, there's language to ensure that extra duty policing does not interfere with regular policing operational requirements.
Thank you, Mr. Bates. Are there any questions for Mr. Bates? Commissioner?
Thanks, Chair. Just some questions on some, I know that you've already worked this through, but just for my understanding, it's mentioned in the policy that the max will be 16 hours a day. So the extra pay plus the regular shift. Am I correct on that?
That would be the HRP policy, I believe. Yeah.
Okay, sorry. Maybe I'm mixing things up
Yeah,
here.
no,
So,
no problem. Yeah.
okay, so we're only talking about our own board policy
Yeah.
about it, not the HRP. Okay,
Yeah.
very good. That's not a question for you.
No.
Can I ask a question to the chief on that? Is that appropriate at this point or no?
Sure.
Okay. Because again, it's a new number to me, 16 hours a day. It seems like a lot, but has there been any issues with that from your perspective, or has that been all right? Or?
I'm not actually familiar with the actual, I don't have the
Okay,
policy in front of me in terms of, but a regular workday is 12 for.
It is,
for-
okay.
For an officer.
So
It would
another
not, it
4
would
is
not
not
be
big
a
deal.
stretch in terms of regular duty, in terms of extending past for 4 hours.
Okay.
Or, yeah, so.
Perfect. That's great context for me. I was picturing 8 hours as normal, but okay, perfect. And then a second question, if I may. Again, I missed the boat on being the board policy. If I can ask the chief superintendent or superintendent the question, is there an HRD equivalent to this extra duty policy? Is that a thing for RCMP? Over.
Sorry, our policies, we have policy on extra duty pay, extra duty requirements, and it's also governed partially by the requirements of the collective agreement that's in place. So all our extra duty is covered by policy or agreement of some sort, including maximum hours worked over a given period of time and that sort of thing. So.
Very good. Thank you. Thanks, sir.
Commissioner Akindoju?
I was trying to refer back to where exactly I read this, but in this amendment, it states that for extra duty, you have to be in uniform. Am I correct? And my question would have been, it's somewhere in this, I'm trying to look at that section. It states clearly that any extra duty officer except otherwise should be in uniform.
That's in the
It's in
board
the policy.
policy?
Yeah. Yeah, it's in both the board policy and in the HRP policy.
Okay, my question would have been, how about it was strategic to be, in plain clothes
Oh,
for that particular extra duty?
As the chief, I can authorize that and will continue to do so when appropriate.
Okay.
Yeah.
All right. I just wanted to clarify that. Okay. Thank you.
Any other questions for the chief? Or, sorry, Mr. Bates? No? Barring none, we'll call for the question. All those in favor of adopting the amendments? Aye. Anyone contrary? No. Motion is passed. Excellent. Thank you, Mr. Bates. That covers 10.2.2. We'll go to 10.2.3, which is the matters of immediate strategic significance. There has been a draft circulated. Would a commissioner be amenable to making a motion at this time? Commissioner Bezic-Escolar.
Thanks, Mr. Chair. I'd like to move that the Board of Police Commissioners for the HRM adopt in principle, subject to a period of public comment, the policy entitled Matters of Immediate Strategic Significance Critical Point for inclusion in the Board of Police Commissioners Policy Manual as outlined in Attachment 1 of the staff report dated 29th April 2025.
Thank you. Mr. Bates, could I request that you give us a little bit of an intro? Thank you.
Definitely, Chair. Thank you. So this policy is our proposed response to 5 of the 13 recommendations in the independent review that are directed at the board. And each of the 5 recommendations reference either directly or indirectly the concept of a critical point policy, which involves formalizing an information sharing protocol with the board when important policing events take place in our community. So staff are recommending that we call our policy matters of immediate strategic significance, because this language more accurately conveys the policy's content and objectives. So in accordance with the independent review, the proposed policy defines a matter of immediate strategic significance, establishes procedures for sharing information with the board subject to security and operational concerns, and this formalizes a current practice, and also requires a formal debriefing where appropriate, and for the content of the debriefing to be reported to the board. And this requirement, I'll add, is also subject to security and operational concerns. And I would be happy to take any questions.
Do any commissioners have Commissioner Mancini?
Thank you, Mr. Chair. Thanks for this, Josh. No question, but you know, in the report, it talks about August 18th, 2021. And so for Councillor Kent, Commissioner Kent and I, that was a tough day in our municipality. And there was a lot of mistakes and that can go around on that day. And I alluded to this before, but I think this is a very good lesson learned from it, is that we're having something major, a critical incident happens or occurs, and there's a plan, there's a strategy, that the chief or the chief superintendent have a conversation, at least with a representative of the Board of Police Commission, be it the chair, so we know what's going on. And so I think this is really good. This is good. This is a good thing. And, you know, it's still raw for me that day. And our officers took it on the chin that day. And so I'm glad this has come forward, so I support it. Thank you.
Thank you, Commissioner. Any other questions for Mr. Bates? Call for the question. All those in favor? Motion carried. All right, so 10.2.3, we'll move on to 10.2.4, which is the armored rescue vehicle policy. Again, would a commissioner like to make a motion? Commissioner Kent.
Thank you. I will move that the Board of Police Commissioners for Halifax Regional Municipality adopt in principle, subject to the period of public comment, the policy entitled Armored Rescue Vehicle for inclusion in the Board of Commissioners Policy Manual as outlined in Attachment 1 of this report.
Second.
So yeah, this one is an important one. It's a you know, really, it's a milestone in our city. I have been supportive of the armored vehicle from the beginning of the conversations around it. We all knew that there was policy going to be required. Our board is taking that very first step to create something and utilize the public engagement piece that we're expected to do. We understand as well that our chief will come forward with, not come forward, but will create the appropriate policies related to the operational side, of which is his mandate. That won't be brought here, but this is a really important piece. I'm really glad to see that we are here now. I fully support this step, and I look forward to when it comes back and it's ratified as it should after public engagement. Thank you.
Do we have a seconder?
Yeah.
Thank you, Commissioner Mancini. Mr. Bates, would you like to offer some introductory comments? Then we'll open it up for questions.
Absolutely. And this is the last policy for consideration for today anyway. Both the board and regional council expressed the importance of adopting an ARV policy prior to its deployment. So that's why we're here today considering this policy. So the proposed policy before you ensures that the approval and oversight of a qualified critical incident commander prior to the deployment of the ARV, that a list be created of approved and non-approved uses, that operators successfully complete a training program, a process to determine whether requests for the use of the ARV by other police services will be considered, the regular inspection and maintenance of the ARV, and the safe storage of the ARV. And the proposed policy, you'll see, also outlines biannual reporting requirements for the chief.
Commissioner Akindoju?
I don't write policies, but I have noticed that you've used a singular word here all through, and in most of your policies. Who is the chief officer as prescribed in your policy here?
Sitting right next to me. The chief officer, I use that language because that's the language of the Police Act.
The issue is, of course, I always talk about risk and how to mitigate risk. So if you look at section 6.3 deployment, if at all you want to use the chief officer, how about the chief officer is in Spain playing golf? Who deploys? When you have said in the policy, the chief officer shall deploy. How about we say here, or somebody who's acting on his behalf? Just a question.
So the chief officer, it's a good question. So the purpose of the policy is to set the parameters of an HRP policy, and the board only has the authority to direct the chief. So the implication of the board policy is that we direct the chief to produce a policy, and the policy, the operational policy that HRP will put forward, will outline, will put into operation the principles in the board policy.
No, I totally agree with you, 100%. But how about if he is not there? This policy does not allow any other person to deploy.
Oh, Marty, I think it does by the virtue of their deputy, right?
Well,
Is acting.
I think that, there's an argument that basically where it says the chief can delegate, has delegating authority, but if you want, you could amend it, a simple amendment to add the chief or designate if you want in that
And our
policy.
policy would state that. Like in
Yeah,
terms
so
of,
if
you know,
Would
It's-
state what?
would state that there would be a designation process. in terms of-
I think this is the proper
That would be
thing
in our
for
policy.
any policy. These things do not apply until you get to court of law, whereby lawyers will tear this apart and will argue in reference to or
Is that true?
Let me
against
just
that.
speak to it again. Basically, if you wanted to propose an amendment to that, it's a friendly amendment. It's just a matter of a couple of words.
I think, sorry, could I
Thank you.
comment? I think the language is fine the way it is. So let me read you the sentence. It says, "The chief officer shall ensure that operational deployment of the ARV requires the approval and oversight of a qualified critical incident commander." Stop. There's nothing else about requiring the chief. It's whoever he's authorized to be qualified incident commanders through his,
I do like the fact that we're playing golf in Spain, though.
I like that idea too.
That's the best part of this whole
Only if you
meeting,
invite me
actually.
though.
But that's not the way I really chair. I mean, honestly, that's not the way. I mean, like I said, this is a policy. It can be written this way, but I'm thinking it's based on what I am reading here. It only allows the chief
I have a
officer to
question
deploy.
on this.
That's my own comment.
Commissioner Kent?
Yes, thank you. Marty, can you, as a lawyer, advise or clarify for me the statement that my colleague made, which is that if this went to court, it would be ripped to shreds, which we basically all know what that means. But would this kind of wording actually, would that not negate that potential risk? This is clearly about deployment. And we're directing that the chief shall ensure that the operational deployment of the ARV requires the approval and oversight of a qualified critical incident commander. Any request for deployment shall include the date, time, location, etc. But that is, I think, and just to be confirmed with Commissioner Akindoju, that this is about deployment, correct? So that's what,
That's why I picked up that particular 6.3. Then
Yeah.
in all the sections, it says the chief. Even when it comes to deployment, it still says the chief. And to help us here, I think the chief.
But the
just
chief-
said in most of their own documents, it says the chief or somebody. How do you say it? Sorry. The chief.
Designate.
Or designate. Yeah.
I got
So-
I mean, it could be a friend here, but I don't care what. I just want to bring it out.
Mr. Ward.
Okay, so the, it's an arguable interpretation based on what's here now, that the chief does ensure that, and the chief could ensure it in any number of ways,
Yeah.
right? One of those might be by having a proper designate. If you wanted more specific clarification, then you would need the additional language to refer to a designate. So to answer your question, would it stand up in court? In my view, yes, it would stand up in court, but that doesn't mean that you couldn't make it more specific if you wanted to. So I leave that with the board. Isn't that a typical lawyer's answer? Just
Yeah,
give a
you didn't help.
non-answer, you know?
Thank you, Mr. Ward. Commissioner Bezic Escanlar.
Thanks, Chair. And I see Commissioner Akindoju's point that it could be read that way. I guess my question to the board is, what is our intent here? Like, are we trying to set up a situation where the chief personally or someone that the chief designates personally has to make the call? Or are we willing to accept that a critical incident commander can make that tactical level decision to deploy the ARV? Because I would think that my read of 6.3 is that the chief officer is responsible to draft the policy, which will call for a chief critical incident commander to be the key step there to make the call to use it. I think that sounds reasonable to me. I'm just wondering if that's the board's thought as well, or are we thinking that we need someone like at the chief's level to make the call to use the ARV? My sense is that we don't, but I don't know if that's Teresa.
Perhaps I'll ask Mr. Bates to comment on the spirit of 6.3, what it was intended for to achieve.
Excuse me, Chair, if I may.
Yes.
I've been a critical incident commander since 2000, and I don't want to age myself too badly, or 2009. And since I have been, had access to what we refer to as a tactical armored vehicle. And the authority for deployment fell to the critical incident commander based on training, experience, tactical, and also on advice received from various tactical unit advice to the incident commander. Basically, it was a notification through briefing after and what had happened. So that's based on my experience, and I just thought I'd add that's pretty. Well, that's the common practice amongst the RCMP anyway.
Thank you, Chief Superintendent. Valuable insight. Any other, Mr. Bates, did
Yeah,
you
sure.
want to
So-
share any comments?
First clause, 6.1, is the chief shall establish a policy with respect to the use of an armored rescue vehicle, right? So everything flows from that, right? So what the intent of 6.3 is that the policy that the chief shall establish includes the requirement as outlined in 6.3. So it's all about the policy. This is not an operational policy. This is a policy directing the chief to produce an operational policy.
Thank you for the distinction, sir. Any other comments or questions, feedback? Commissioner?
Thanks, Chair. So on that basis, and from what Chief Superintendent said, I think that what is written reflects what we're trying to get at, and that we're trying not to get a situation where the chief is out golfing somewhere and is in Spain specifically, and unable to, and that we are somehow tied to not be able to use the ARV. I think we do want to have, as Chief Superintendent said, we do want to have someone at the tactical, not as high up as a chief, but a critical incident commander being able to use it in their professional judgment. I do have a question though about, so it says chief officer, but in the definitions in section 4, it just says chiefs. I don't know if that's going to be a critical issue for for this policy or not, and if it's even worth bringing up.
I can speak to that. Yeah. So there's an existing template in the policy manual before I took on this role, and so I dropped this policy into that template. So the definition of chiefs was already there, and so if we're going to change one of them, we should change all of them, and that's just hasn't risen to the top of my to-do list. But like I said, the term chief officer is what's in the Police Act, so that's why I've written it into the policy.
And so we all understand that that is, that is you, Chief McLean, who's going to do this. Very good.
I mean, you could propose a small amendment to add into the definition that chief of police means whatever and includes chief officer, if you wanted. If you think lawyers are going to pick it apart at some point, but I don't think overall it's going to make
No one
any
else
difference.
wants it, trust me.
Go ahead. Oh,
Sorry, I'll just comment that, like Commissioner Kent said, this does seem to be a critical tool that we as Haligonians want to have our police services to have access to, not just for their own safety, but for the safety of the public. In my other hat as a physician, I've worked with EHS, emergency preparedness and special operations. I know that some of the people I've discussed over there are, see the need for this in supporting your operations. I've had the opportunity to just chat by email with Constable Ben McLean, who is, I believe, I'm going to mess up his title, but he basically is in charge of the medical aspects of the emergency response team on the RCMP side. And from a medical perspective, I do see the value in having this, and I look forward to seeing the policy that Chief McLean will develop, assuming that this motion passes. Thank you.
Yeah.
Mr. Ward.
I think you do need a small amendment here. The definition does not match the body of the thing, so I think you need to change. Pardon? Yeah, why don't we use I think we should use the wording of the act, which is chief officer, right? Yeah. Go ahead,
Just,
Bill.
just if we go to the Police Act under definition C, chief officer means the chief of police of a police department and includes an officer acting as a chief of police. So you've covered off the designation perspective as well and brought the two of them together. So as long as we're pointing our policies are being done, created under a bylaw that's reflective of the Police Act, I think we're lined up.
So no need for change?
Well,
Or
I
do you
think,
want to?
well, that's roundabout, it works.
No, it's either way. I'm just.
It works. I just think it's nice to have these policies that if they're made pursuant to the Police Act, that they actually reflect the definition in the Police Act. That's my thought. I don't think it's a lot of trouble to have a friendly amendment to change that to chief officer the way it is. Well, I think in the definition, right, I would think you should say chief officer means the chief of police of the Halifax Regional Police. That's simple. It's friendly.
Sure. Thank you, Commissioner.
Okay, I will move that the definition for what is listed here as chief of police be amended to be the chief officer means the chief of Halifax Regional Police.
Right.
And that's because that's aligning. It actually makes sense because we are referencing the chiefs of police, the chief officer, but we really in the dictionary or sorry, in the definitions, we didn't speak to the chief officer. So this is speaking to it. So then it closes the loop. So
So you want to propose replacing
that
the definition of chief of police with chief officer and using the definition directly out of the Police Act?
So instead, under the definitions, if you look on page, first attachment 1, with the 4 definitions, we see,
Okay.
we show chief of police.
Yep.
I'm recommending that be changed to chief officer means the chief of the Halifax Regional Police.
I'm guessing this is probably going to affect a whole lot of policies actually at some particular point. So it's probably bigger than this.
Well, we can address them each at a time. I mean, it's,
When I said that, I assume in all the places that it's being used, generated, just including.
Board policies anyhow.
yeah,
Not
board,
mine, board
yeah,
members.
board policies.
The point is, as the vice chair says, The policy itself speaks to chief officer, chief officer, chief officer, chief officer.
Yeah.
And when you go to the definition
You
section,
don't
right?
see that.
It doesn't say anything about chief officer. So all this
So-
does is make chief officer be the chief of the Halifax Regional Police. So it's consistent all the way through the policy.
Okay. I have a question here.
Commissioner, so just on the motion, I think the chief brings up a good point that there was a risk that if we use the term chief officer in other documents, we might be redefining for things. But I think our save here, however, is on section 4, it says in the context of this document. So I think if we're clear that it's only for this document that we're making that change, I think we're going to avoid any potential of anything else here. Over.
I can see the distinction though, because if we look at the flow of information here, we have the chief of police and then we use the word chiefs. And for chiefs, we say the chief of police and the chief superintendent. And we don't have the authority to direct policy to the chief superintendent. So it has to be narrowly focused toward the Halifax Regional Police, the chief of police. Is that, are we screwing with the template by altering that at this point? That's my only concern, just. Yeah. So what, okay. Friendly amendment's been proposed.
Okay, question? We don't need to, because we're referencing the chief. He has, do we have to have the chief officer, the other thing? What'd you just say?
Chief officer includes the chief of police.
Right.
And includes an officer acting as the chief of police.
Yeah,
So it
so
covers
we're
off your
covered,
designation.
we're covered off. Good.
It's amazing.
All right, we call for the question on the amendment. All those in favor of the amendment? We have to vote on this one first. Yeah. Okay.
So you can just vote on the whole thing. if you want.
Okay. All right. Commissioner Moore, did you have anything that you wanted to add?
I don't want to sound argumentative. I just, when I look, if we're going to use, and I certainly understand where we use the chiefs in relation to chief superintendent, but they think the act is clear on what the board can or cannot do in relation to the RCMP. So in the board, for clarity's sake, if the board's policies are coming from the Police Act, and if the Police Act definition clearly outlines the chief officer being the chief of police of a municipal department and someone who is, and an officer acting as the chief of police, it covers off both the designation issue, as mentioned by Commissioner Akindoju, but it kind of brings you back to, I know we use the terms loosely around chiefs, but chief superintendent, clearly under the act, chief superintendent is not that chief of a municipal department, right? So it's obviously it's whatever the board wants to do in relation to the policy, but if we have a working definition that works out of the act, it seems to me that we would point to the act and use that all the way through.
Yes, the beauty of this is it saves anybody who looks at this policy and sees a difference between the chief of police in the definition section and the word chief officer in the body, right? Will would ask a question, whereas if you put this in, they're never going to ask the question. So it just puts it to bed.
All right, so we have the friendly amendment. We just friendly on the whole motion.
I've got a question.
Okay, sorry.
Commissioner Hinch.
So say if the chief goes to golf wherever he decides to go to golfing, do you swear somebody in? Is that how it works?
Designate them as.
You just designate them?
Yeah, as the acting chief.
Okay. And is there somebody that would, so say if you went tomorrow, is there somebody that you already have ready to be appointed or?
The one of the deputies.
One of the deputies.
Yeah.
Okay, all right.
And if they weren't there, it'd be one of the superintendents. Like, when I was a superintendent, I was an acting chief at one time. It just,
Chain of command.
Okay.
Commissioner.
Sorry, I have lots of questions, Chair. Thank you. So after this goes to you, Chief, to write the policy, do we as a board actually approve the policy? Like, let's say you come up with your list of approved and not approved uses. Do we have any oversight role into those at that point? Just for my personal understanding.
Maybe we'll ask Mr. Ward to address that. Thank you.
I think the role of the board at that point would be to ask the chief for a staff report as to how his policy aligns with the board policy. Okay.
Thank you.
There was
And
a
I think,
concern, and then coming forward, if the board was not pleased with the result of that, they could then amend their policy and ask, right?
thank you. And I think it's clear in the policy that we would want the policy that you will write, Chief, to be aligned with the strategic plan and the principles of policing, which I think we are all on board with, but just for my understanding of the process and how things happen next. So thank you. Thank you.
Very good. Are we ready for the question? All right. And again, this is adopting this for public review, and we'll be bringing this back at the appropriate time for finalization. So all those in favor? All those against? Motion passed. Thank you. All right, so we're going to move on to 10.3.1, which is Commissioner Mancini's motion to review the Halifax Regional Police's use of RCMPH Division's Sexual Assault Investigative Review Committee process. Commissioner Mancini.
Thank you, Mr. Chair. I'll put the following motion on the floor, and then I'll speak to it. That the Board of Police Commissioners for the Halifax Regional Municipality direct the Chief Officer of the Halifax Regional Police and recommend that the officer in charge of the Royal Canadian Mounted Police Halifax Regional Detachment prepare a staff report from the Halifax Regional Police evaluating the performance and the findings to date from the use of the RCMP Division Nova Scotia Sexual Assault Investigation Review Committee, SAIRC, process in the review of sexual assault cases which did not lead to arrest. So moved. Yeah, thank you for that, Commissioner Hinch. So my rationale, and this was implemented before my time here in the Board of Police Commission. And so now we've had some time that's gone by. I'm looking for some data. And I'll be specific on what I'm looking for. I'm looking for the following. How many files have been reviewed at the SAIRC table since its inception? How many reviewed files have resulted in additional investigation actions as opposed to just clerical changes? How many investigations have been reopened as a result of the review? And were there any reopened cases that resulted in a charge being laid? So that I'm looking for the data since the decision was made to implement this, because if we recall, from the mass casualty recommendation was that a different model would be used for HR police and other police stations. That would be the VACR model, violence against case review. So the decision at the time, based on the HRP response, was to come back, and there was two issues. One was because we have this dual police force and the RCMP are directed federally on which model they use, that it would be, I'm paraphrasing, maybe complicated to have a different model. The other issue was that there was a privacy issue that was the rationale. So what I'm looking for is, okay, we've had this model in place. I want to see the data so we can have further conversation to make sure, in fact, this is the right model for Halifax Regional Police. So that's the purpose of me bringing this forward. Thank you. I hope you support it.
Thank you, Commissioner. Would any other commissioners like to speak to the Commissioner Kent?
Thank you, Commissioner Mancini. I had to read it several times to make sure that it was like, who's doing what? Who's on first? But I've landed, and I support the motion. What I'm not sure about is, have we given it enough time to get enough data that is really going to be beneficial to us? Can you remind us when we started that pilot? Maybe, Chief? I don't feel like it was very long ago.
It was earlier this year. Yeah.
So we're in May. And
Was it?
I think it was last year.
I think it was
No,
like
it wasn't
summer.
last year.
It was-
no,
it was
I
before
don't,
my
I
time
don't
on
feel
job.
like it
No,
was
it was
either.
not last year.
It was
Before my
January?
time, anyway.
Okay, so
The
we got,
motion,
yeah,
I can find out for you certainly, but I'm pretty sure
no, it was January.
it's January.
Yeah.
Yeah.
So we've got little, whatever amount of time in January, February, March, April, May. I'd like to see it at 6 months, to be honest. I definitely agree. I'm not sure that we've given it long enough to get enough data to be able to assess if it's succeeding or not. If it's not succeeding, because that's the wrong word, if it's going to be useful. And of course, the end result would be that we'd have to have both chiefs be prepared to present to us and speak to the data that we're seeing, right? So could a friendly amendment be that at the 6-month mark?
What do you want to achieve in 2 months' time?
Pardon me?
What's going to be different in 2 months' time?
More data.
We don't even know how many data we have.
No, exactly.
So why
We
should talk
don't.
about more in 6 months?
maybe we could ask the chiefs to comment about the cadence thus far and whether
Yeah,
they feel
so
there's
I-
sufficient data to give us some feedback on an interim basis.
I'm not familiar right here at the moment how often they actually, because they don't meet every week. They meet on a specific period of time. I know they met in May, actually, in terms of, I know they met this month. And I'm not sure when they're scheduled to meet again, that maybe Don may know better than I do in terms of what but it's going to take some time to get a working sort of.
Yeah.
Chair, I can pass it over to, Don has a little bit of information on that.
Superintendent?
Yes, Chair, through you to the board, Commissioner Ken, I think that's reasonable, 6 months. Just at the 6-month mark, I think is a reasonable time to come back and assess what we've done. I know the work is continued within that integrated CID model. I know they've worked through a body of work at this point. I would be not in a position to comment on the results of that work, but I think in a few months, I think that's reasonable to come back with an update on progress and how we've done collectively on that work.
And I thought the original motion talked about an assessment after a period of time, like.
Okay,
That's
that's
thought.
what I thought as well.
I don't remember what that actually was, that time.
Thank you, Madam Clerk. The Board of Police Commissioners is reconvening. Do we have a motion?
Put up on the TV, please.
There's a proposed
Yeah.
motion, and I believe Commissioner Kent is going to propose a motion.
Because we're on item,
Um,
thank you.
Yeah.
Thank you. Thank you, Mr. Chair. I put forward that the Board of Police Commissioners of Halifax Regional Municipality 1, in accordance with S4 of the Board of Police Commissioners Administrative Policy, waive S15 of the policy requiring a staff report for either the chief or policy advisor to the board. And 2, approve Commissioners O'Malley, Beswick Escanlar, and Mancini to attend the 36th Annual Canadian Association of Police Governance, CAPG, conference in Victoria, BC, as representative for the board. So moved.
Is there a seconder?
Yummy.
Commissioner Akindoju? Any discussion on the motion?
Question?
All in favor of the motion?
Aye.
Motion's passed. Do we have a motion for adjournment? Oh, what's the rest of the agenda? I put the papers away. Oh, okay. Sorry. That. Okay.
Any notices of motion? Does that say that? Or you can say
So 12.1, the personal matter, that was, do we need a word? We don't need anything in terms of a motion there. Do we have to accept the
We
private
didn't-
and confidential report? Yeah. Okay. Would someone like to propose the motion that's been drafted by the clerk? Commissioner Vince.
Thanks, Mr. Chair. Thanks. I move that the Board of Police Commissioners for the Halifax Regional Municipality direct that the private and confidential report dated 25th April 2025 be maintained private and confidential.
Second.
Thank you, Commissioner Bessick Escanlar. Thank you, Commissioner Kent. All those in favor of the motion?
Aye.
Motion passed. So item 13, are there any notices of motion? Barring none, Madam Clerk, have you received any notices?
No, I have not, but if I had, they still need to be read
Oh.
out in public.
Oh, okay. Thank you very much. So the date of the next meeting is June 4th, and can we call for a mover to adjourn? I don't think we need to vote on adjournment. Yeah.
Good job, folks.
Well, we got all the policy stuff.